I saw these pictures of it kind of going through like lines, and I thought, oh, it must just travel through lines like that. But it's actually the whole area is really, really moist. So it adds hydration and suppleness, which is crucial for our movement because we are 70%, I think it is, fluid. If the sticky proteins within the extracellular matrix called basilaminea, become thin and dry, the membranes start to stick together. The collagen fibers then build up and become stiff and locked and dry. This means the basilaminea can no longer distribute nutrients and the body will lack hydration. So this comes from people who hold poor posture patterns or tension patterns, or perhaps have been in pain. So maybe they've had like a shoulder injury and they've got really used to holding the shoulder really tight and firm and secure for safety. Then they're too frightened to mobilize it because they're worried about the pain. And we have to find ways to mobilize it because otherwise that shoulder will become more and more dry and locked as time goes on. So the mobilization post-injury is really, really important, and building up more mobility within the body. This is the same with pelvic floor dysfunction. So if we are starting to try and mobilize the pelvic floor in order to make it more functional, we need to get our women to start moving the pelvises and start engaging that pelvic floor and not holding it tight through tension patterns. And we'll go through some of them today too. So, having a knowledge of the composition and characteristics of fascia is important so we can understand its multifaceted roles within the body. Fascia gives our body structural support to facilitate movement and to ensure the flow of our bodily functions. Fascia is a dynamic entity, integral to overall health and well-being. Therefore, delving into the intricacies of fascia unveils a profound appreciation of the complexity and significance of this really usually overlooked component of anatomy. We know much, much more now than we used to, but it's still not something people still think about muscles, tendons and ligaments, much, much more than looking at the whole. And nowadays, and we'll go on with this presentation as well, nowadays we know that tendons and ligaments are all part of the same fascial network and matrix. It's fascia in a different form. These are really beautiful pictures that you get from Tom Myers. And Tom Myers' book, Get Anatomy Trains, gives us pictures of fascia in the same way that muscle books give us pictures of muscle. So we can look at these pictures and we can go, all right, so that's a fascia line. But that's not the whole picture. These fascia lines integrate with each other and integrate with the muscle lines and muscle groups. So if you think about fascia, fascia is totally and utterly connected in with muscles, with ligaments. So though these lines give us an idea, these train tracks give us an idea, or tracks give us an idea of how we could stretch the fascia from one point to another point, we also have to remember that we're also engaging muscle chains within these as well. So everything is so super, super interconnected. The connections that go from fascia, ligaments, and into bones. It's like the fascia actually merges in with the bone. So it's actually a living part of the bone itself. I've just finished a course on that, so I'm kind of like blown by bones and fascia at the moment. So fascia lines, here's another picture of them to get a look at. So there's some really cool connections, both with muscles and fascia chains through the whole body like a loop. So we got two muscles here. So we've got our muscles here, our scalenes that come down here and join here. Then we come into our kind of breast system here. So this is our muscles, but our fascia follows a really similar route. We've got muscles that come, so it's two here. Then it comes into a single muscle chain down here. And then when we get into our pelvic floor, it splits into two again for the levator ani as it goes round towards the coccyx. And then from there, it becomes part of the sacral line, and then it comes into two again back into the paraspinals. So we have this kind of loop that comes all the way around our body in a muscular way. But we also have a similar route when we think about the fascia. So we have a connection that goes from our belly button, from our bladder. So from the detrusor muscle, we have a connection that goes through the medium ligament to the belly button. And this used to be the uricus, where we excreted urine into our mum until we were 12 weeks in utero. That then becomes part of the anterior fascia chain that comes up through the diaphragm to what comes to the round ligament of the liver, then through the diaphragm, it's called the falciform ligament, and then comes through the diaphragm and then up towards the heart and continues up towards our throat and neck and tongue. This same connection that goes from the bladder also goes through the lever to ani muscles as part of the fascial connections through them to the sacroiliac, the big ligament at the back of our pelvis, and then from there becomes part of the posterior chain. So we have a muscle loop and a fascia loop that go in the same direction, and this is the case throughout the body. So fascia and muscle connects in with each other, they connect in with bones. So we have to look at the whole body and mobilizing everything within the body to get to both the fascia, the muscle, and moving the bones. And the bones are just as important. We have to really think about how we're moving them too. Okay, so we're going to learn about a little bit about the different types of fascia. Within the pelvis, we have layers and layers and layers of different types of fascia, but we're going to look at the whole body as a kind of general fascia network. So fascia doesn't tend to stretch in the longitudinal line, but it does in the circumference. So the reason that this is because the elastin fibers tend to be more of the zigzag fibers, and the collagen fibers are more of the longitudinal fibers. So when we are stretching the fascia, we're actually stretching out those horizontal lines. We can kind of see them here in this picture. The picture to the left is a little bit, it's not got zigzag lines, but if we imagine that the long lines coming, the longitudinal lines are straighter lines, and the ones in between are zigzags. So when we're wanting to stretch or activate the fascia, it's the horizontal bands that stretch, and it's the weave and the zigzag lines. And the other ones hold everything in place. So we've got the fascia as a supportive network, but also as a network that can expand and contract. And that's really important because we wouldn't, otherwise we'd all be like jelly. Okay, so fascia is made up of lots of different things. It's made up of the sheets of connective tissue that are found below the skin. These tissues attach, stabilize, and impart strength and maintain vessel patency. They separate muscles and enclose different organs. Traditionally, the word fascia was used primarily by surgeons to describe the dissectable tissue seen in the body encasing other organs, muscles, and bones. So they used to just dissect it off, chuck it in a bin, didn't think it had any importance. And this was mainly due to the way we embalmed bodies as well. So the fascia used to dry up, so it just looked like something that was just a covering that had no function because we couldn't see the moisture within it. We couldn't see it as a living organism. Recently, the definition has been broadened of fascia to include all collagenous-based soft tissues in the body, including cells that create and maintain the extracellular matrix. So the extracellular matrix is like our ground substance. It's what absorbs the moisture into our body. The new definition also includes certain tendons, ligaments, bursae, endomysium, perimysium, and epimysium. So these are the coverings of the bones and the muscles. There's also talk of bone being much more fascial as well, especially the trabecular, the inside of the bone. The inside of the bone is quite spongy and is quite moist and quite mobile, whereas the casing around the outside of the bone is more the stabilizer. So 2%, I think it's the outside casing of the bone has only 2% mobilization within it, but the inside of your bone has got a stretch of between 30 and 60%. So it's a huge difference between the two areas of our bones. And it needs that because it's got blood vessels flowing through it, it's got arteries, it's got loads of stuff going through each bone. So fascia can be classified as lots of different things, but we kind of classify it as either being superficial, deep, or visceral, or by its location in the body. So we could call it parietal fascia, or we could call it pelvic fascia, or we could call it thoracic fascia. So it gets called by where it is in the body as well. So there's lots of different ways to classify it. The reason this one's in here, this picture's in here as well, is to see this, if you can see this red line that goes all the way around here, all the way around the cavity, the parietal, here's Bretta, all the way, this parietal fascia here. And you can see how it comes along the top of the bladder, the top of the uterus, and the top of the rectum. It is this fascia connection, and up the top here is the diaphragm, it is this fascia connection that draws upwards or creates that visceral traction when we perform the apnea. As our diaphragm descends and creates more space in the thoracic cavity, our body then creates a contraction or a lifting of the fascia to create less space in the abdominal cavity. And it's this fascia that draws or creates the visceral traction of the organs. Any questions about that? Okay, cool. This picture's here as well, not just to show you kind of what the different types of fascia can look like, but also because I wanted to show you that connection I've talked about from the bladder to the belly button up through to the round ligament of the liver. So if you look here, so here's the close-up of it. This is the only one I found that's clear enough, really, so that I can use, I'm allowed to use. So from the belly button, you can see from the belly button here, it comes into the abdominal wall here. And then if you look on the next picture, the bigger picture, you can see how that connection goes down through the white connection all the way down to the top of the bladder. And this is the medium ligament or the uricus. So we've got an actual direct connection. So when we do the apnea breath and we can feel the belly button starts to slide up or change shape, we can show that we're activating this, we're actually lifting the bladder, which is why with hypopressives initially, you get better results initially for bladder issues and for a prolapsed bladder, and the uterus and the rectum take a little bit longer. The uterus and the rectum are relying on that whole parietal fascia doing that visceral lift, and they're relying on the slow functionality being built with the breath work, and they're relying on over time the posture patterns helping to make a change. The bladder gets an extra help because it has this drawing up through the anterior fascia chain. Any questions about that one? And you can see how it goes all the way up from the belly button, all the way up through to the liver and round there and in towards the diaphragm. So superficial fascia is the fascia that found directly underneath the skin. And superficial adipose layers, fat layers, they're also part of our fascia. It can show, we can see it grossly and microscopically. So it's found both in large amounts and small amounts. Traditionally, it's described as being made up of membranous layers with closely packed interwoven collagen and elastin fibers. Superficial fascia is thicker in the trunk area of our body than in the limbs and becomes thinner peripherally. So, generally, superficial fascia is closer to the surface. However, with our fingers, it is deep fascia. And the reason why our fingers are deep fascia is because they have, I'll come to it in a minute. I'll not jump ahead. So I'll come to it in a minute. So yeah, there's a reason for the deep fascia because our fingers need to be able to touch, feel heat and cold. So superficial fascia layers can sometimes include muscle fibers to create all types of structure in the body. A few examples include the platysma muscle in the neck. So this muscle in the neck is actually fascia. So if you do that kind of horrible face, this one, you can see the platysma fascia. So this whole area here is that we think is predominantly muscles, actually fascia. So it's a big, huge kind of neck load of fascia here, or necklace is a better word. The other one is the external anal sphincter. We think of that as a muscle and that we have control over, but it's actually predominantly fascia and connective tissue. And then the only real muscle that's talked about as a muscle in the scrotum is also fascia. So it's called the dartus fascia in the scrotum. A subtype of superficial fascia in the abdomen is called Scarpa's fascia. We only find these little kind of round circular fascia in the abdomen. So it's the only place we find Scarpa's fascia. So fascia can look differently and have different jobs almost in different parts of the body. So it can be there working as like it's a muscle, or it can be there working as a protection, or it can be there working as a covering, or it can be there working like a muscle within the body. Deep fascia has a different role than superficial fascia. It surrounds the bones, muscles, nerves, and blood vessels. And that's why we need to have it in our fingertips, because our fingertips have these deep, free encapsulated nerve endings. They're called ruffini and Pacini corpuscles. And the reason we have them in our fingers is so that if we touch something and it's hot, we can go, oh, that's hot, and not touch it anymore. So we have to have this immediate reaction to our nervous system. And that's fed through the deep fascia and these free encapsulated nerve endings. So deep fascia commonly has a more fibrous consistency and is really rich in hyaluron as compared to the other subtypes. Deep fascia tends to be highly vascularized and contain well-developed lymphatic channels. So there's much more feeding deep fascia than superficial fascia. Okay. Visceral fascia, so all the different subtypes are, so this is some of the different subtypes. We have visceral fascia. Visceral fascia surrounds organs and cavities like the abdominals, lungs, and heart. Parietal fascia is a general term for tissues that line the wall of a body cavity, so just outside of the parietal layer. The most commonly known parietal fascia is found in the pelvis and in the abdominals. In many places in the body, superficial and deep fascial layers are connected by a fibrous septa and create a connection network. So they're not separate. I don't ever want anybody to think that these different fascial layers are separate. The superficial fascial layer feeds into the deep fascial layer. The deep fascial layer feeds into the superficial. The superficial and deep fascial layers into the parietal and the visceral fascia too. They're all interconnected and woven together. Yeah, that's what I was saying there. So this is some pictures just to let you see how much the fascia envelops the pelvic organs. So the pelvic organs are supported by ligaments and by tendons, but they're also wrapped up with a huge amount of fascia that creates a support for them. And remember how fascia has these two roles within its cells. You know, it's collagen and elastin. So the elastin allows the pelvic organs to be able to move. So our pelvic organs move as we move. And the collagen helps to hold the organs in place. So we've got both stability and movement ability within the organs themselves. So we can have babies and have sex and defecate and pee and do all the things we need to be able to do with these organs, and at the same time be able to walk and move. So they have to be mobile and they have to have a functional ability to them. So it's really important that we keep that movement in them. And a lot of my ladies who have had maybe they've had a little bit of a niggle of needing pads sometimes when they go to exercise classes and things, or they've got, they've got holding patterns already in their bodies because they have minor dysfunction. So they stop moving their pelvises quite so much. And then when they come to perimenopause and menopause, and they don't have so much support within the collagen in the fascia, they suddenly feel like they say to me, oh, I was out walking the dog and I bent over and I suddenly felt everything drop. But it's not so much that it's a sudden thing, it's that their pelvises have been held tight for so long, and with a dip in collagen through perimenopause and menopause, and the lack of movement in their pelvis, it's been a combination. So whatever's happened to create the imbalance with the pelvic floor, so the trauma, they've stopped moving, and then they have perimenopause and the dip in collagen. So it's a threefold thing that happens. So my big push with all of my ladies when they come to me, especially is perimenopause, if we need to get your pelvises moving. And it's really, really important that we do, because we can start feeding that moisture back into the collagen and the elastin fibers through movement. And this is really, really important. So fascia also provides support. That was me off on a tangent there. So provides support for surrounding tissues. It helps to reduce friction, which is important for our pelvic floor, our pelvic organs when they move, and plays a supportive role for tissues and organs. Fascia can transmit tension generated by muscular activity or external forces. So for example, when we jump, there's a whole lot of tension and external force, and our fascia acts to force absorb. So it helps us to force absorb, but we have to already have that moisture in the fascia to allow it to do that. The biomechanical regulatory system of the fascia is currently being studied further, and this area of anatomy changes almost daily, and it really, really does. So I've just done some more learning on bones and how just the movement of the way we move our bones can contribute to the growth of the fibroblasts in our bones, creating more bone. So as we age, we don't necessarily have to go into decline with bone health as long as we keep doing all the different movement patterns with our bones. And don't stick to one type of movement pattern because our bones get bored and stop making bone. Who knew, eh? So in a healthy state, fascia is a relaxed and wavy connective tissue that becomes dry and tight when damaged because of trauma and inflammation. This can then cause fascial layers to tighten and restrict the movement of underlying tissues, leading to pain, hindered range of motion, or decreased blood flow. Any questions about all of that? Because that was quite a lot of information on one page. Is everybody okay? Cool. Okay, so nerves. Sensory nerves innervate the fascial tissue. The deep fascia specifically is extensively innervated with multiple sensory nerve subtypes. So these are all the different kind of nerve subtypes. These aren't all of them, but some of them. Nociceptors, proprioceptors, these show you where your body is. So it tells your fascia and your tissue where your body is. So where my arm is in space, whether it's up, whether it's down. So these are all signals. Mechanical receptors, how my body is moving, how I want it to move, how fast it's moving, how slow I want it to move. Thermoreceptors telling us about how hot or cold our body is. And these are all fed through the deep fascia. And also chemoreceptors telling us about hormones and what our body needs for calcium, all of this sort of thing, calcium receptors as well. So it's really important. One of the most important things that I kind of give my ladies to take away with them is how poor posture can really negatively influence how their body moves, but also can influence the circulation of blood to the brain. There is an artery that runs. So a lot of my ladies have this forward head position. And, you complain of headaches. They blame perimenopause. A lot of my ladies blame perimenopause and menopause and their forgetfulness. I do too, but oh, my forgetting words. But some of this can come from poor posture. There's an artery that runs through the vertebra and it's compressed when there's a forward head posture, which compromises the blood flow to the brain. So it's really important that we bring people's heads back and that they're really, really aware of their posture. So this is for the actual flow of blood to the brain and the, on oxygenization of that whole area. So the other way that chronically poor posture will influence the fascia is with what's called the Gogli tendon organs. These are connected between the muscle fibers and tendons, and they sense changes in the muscle tendons themselves. This is different from what's called the Gogli tendon reflex, which is when swelling or pressure on the tendon will cause the muscle to release to prevent further damage. So when we change our posture and alignment, the Gogli tendon organ tells the joint where it is in space. But with poor posture, when it becomes habitual, think about kids always looking down at their phone or us looking always down at our phone. The Gogli tendon then resets where normal is, and that person's proprioception is being influenced. So when I get my ladies or get my children to think about bringing their head back over their shoulders, they go, "It doesn't feel right, Mum." Or my ladies go, "It feels much more comfortable the way I have my head now." And it's because this Gogli tendon organ has reset. So it's going to take time for us to get people back into a great posture that feels good for them in their bodies. So it's not going to be an overnight fix, is what I'm saying, I think, here. Any questions about that? Okay. The other thing that creates imbalances within our fascia is our dysfunctional breathing patterns. So dysfunctional breathing patterns create muscle imbalances. They create and also fascia imbalances. So if we're not moving it in a really effective way, we're going to create imbalances. We create hyperventilation, poor spinal stability. That brings stress and anxiety, and also vocal cord disorders, essentially at the end of the cycle. Dysfunctional breathing creates a toxic cycle. We increase heart rate, blood pressure, anxiety. This increases your fight or flight response, which jettisons your parasympathetic nervous system, which means your body goes to kind of trying to sustain the heart and lungs and our ability to run, and kind of jettisons, to a certain extent, all other functions. We have excessive CO2, respiratory alkalosis, our blood pH becomes more alkaline, we increase muscle tension, vessels and gut gets constricted, then it goes to either overuse of upper chest breathing and neck pain, or cramps, posture imbalances, muscle weaknesses, dizziness and stress, increased stress, more insufficient breathing pattern, and it becomes a toxic cycle. So breaking this toxic cycle of breathing is one of the best ways that we can start to activate the whole body and the whole fascia system. Okay, so any questions about fascia so far? Because that's kind of been our overview, and we're going to duck back to it as we do practical when I talk about it a little bit more. Okay, so we're going to talk about progression of breath. A lot of times, so we have to choose how we're going to progress the breath with our clients and what we're going to do. And there's reasons for the different ways we can breathe in hypopressives. Every session and every group is different. Folk come to hypopressives for different reasons. And as a teacher, you're going to choose which way to guide them. As a rule with breathing, you should encourage folk to exhale for twice the amount of time they inhale for. Now, this is really important because this is helping them to build up their CO2 tolerance. Slow breathing encourages full oxygen exchange. That is, the beneficial trade of incoming oxygen for outgoing carbon dioxide. Not surprisingly, this type of breathing slows the heartbeat and can stabilize blood pressure. How long will you breathe each time? So, for sessions to reduce anxiety, for sessions for beginners, for meditative and focused engagement of breath, the mind and the pelvic floor, we're looking for people to inhale for roughly about 3, and exhale for roughly 6. Or to inhale for 4 and exhale for roughly 8. Now, if you're teaching one-to-one with people, I really encourage people to try and find their own breath cycle, but really lengthening the exhale. When I coach classes, I count to keep everybody together, but I mix and match. Sometimes we do 3 and 6, sometimes we do 4 and 8, sometimes I let them try 5 and 10, but I'm looking to lengthen the breath as much as possible. We always, in my classes for pelvic floor dysfunction, if that's what we're targeting, have 3 breaths, and then their apnea and rib opening for each change in position. Now, sometimes I play with this, sometimes we'll do 2 breaths just for fun. And we did a session where we were supine and we did 1 breath and then apnea, again, just for fun. So sometimes it's nice to just play around with the breath to see how people get on. However, we do have a strategy for those wanting to increase heart rate and reduce residual oxygen. So this is for people who are training for a sports event. So we want to go into more of a hypoxic training. So the one on the left for reducing anxiety for beginners is slightly hypoxic. So we're doing a little mini hypoxic kind of training for them, which is helping them to improve stamina and is helping oxygen distribution. However, if we're wanting to train people to go and do something, so I've had clients who've wanted to go and run a marathon, or they're a triathlete, or they've got a swimming competition coming up, or they're going to swim across the Firth of Forth, so we're looking at how we can better optimize their oxygen and their CO2. So for them, we change the breathing. They inhale for 2 and exhale for 4. This means they have less residual oxygen in their body when they come to do the apnea. And then once they're really comfortable with that, with 3 breaths, and then an apnea, and take their apnea to 12 to 15 seconds, then we can reduce it and do inhale for 2, exhale for 2. So we're really reducing the amount of residual oxygen. Then we can play with the cycle. So once they've managed to do that and managed to hold for a decent amount of apnea time, then we can change the cycle. We can do 2 breaths, the apnea and rib opening. And then once they're really comfortable with that, we can reduce it more and do 1 breath, apnea and rib opening for each position. Any questions about the breath work?
Yes.
Good.
What speed are you counting at?
So I used to have a metronome thing that I used to use that kept me counting at a nice speed for everybody, but I kind of have a song. So I've got into a rhythm of a song when I count people. So I count them as a in, 2, 3, out, 5, 4, 3, 2, 1. So it's that kind of speed that I'm counting them at.
Yeah. So the people that are doing it, sort of the sports people who are inhaling for 2,
Yeah.
that's a slow 2, as opposed to them breathing quickly.
Yeah, it'll be a slow 2, yeah.
Brilliant. Okay.
Yeah. It's already going to be pretty reduced with a hypoxic training with just a breath in for 2 and out for 2. In fact, let's try it just now while we're here. So I would like you just to take a moment and I'll count you. So we're going to do 3 breaths and an apnea, and we're going to do 3 and 6 for our breathing. And we're going to hold the apnea for a count of 10. If you need to breathe before the 10, that's fine, you know? So we're going to do 3 and 6, we're going to do 4 and 8, and then we're going to do the shorter ones. So we're going to do 3 breaths and our apnea. So if everybody's ready, so ready to inhale. In, 2, 3, out, 5, 4, 3, 2, 1. In, 2, 3, out, 5, 4, 3, 2, 1. In, 2, 3, out, 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Inhale there. Okay, remember how that felt in your body? And we're going to do 4 and 8 next. So we're going to breathe for 4 and 8, and we're going to do 3 breaths and then your apnea. So ready to inhale. In, 2, 3, 4, out, 7, 6, 5, 4, 3, 2, 1. In, 2, 3, 4, out, 7, 6, 5, 4, 3, 2, 1. In, 2, 3, 4, out, 7, 6, 5, 4, 3, 2, 1. Close your mouth and nose, pause. Slowly widening your ribs for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Inhaling. Okay, so this time we're going to inhale for 2 and exhale for 4. And we're going to do it with 3 breaths and an apnea first, then 2 breaths, then 1 breath. Okay, so we're ready to inhale. In, 2, out, 3, 2, 1. In, 2, out, 3, 2, 1. In, 2, out, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. In, 2, out, 3, 2, 1. In, 2, out, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. In, 2, out, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Inhale here. So, how did they make you feel when you were doing them? Did you feel calmer doing 3, 6, 4, and 8? Did you feel a little bit more stressed out doing 2 and 4?
So with the 2 and 4, you're not taking a full lungful. You are just breathing into the 2, and then whatever you've got, you're taking out again.
Yep.
Yeah.
So what we're doing is we're building up more and more CO2 in the system, less and less residual oxygen. So we are becoming more and more CO2 tolerant, hopefully, as we do it, which means that when we are running and things, we're using the oxygen in a more efficient way.
Yeah.
So this is essentially hypoxic training, intermittent hypoxic training.
Yeah.
But we are doing that at the 3 and 6, just in a nicer, calmer way.
Yeah.
And if you think about it, the 3, 6, 4, and 8, if we're talking to women's nervous systems or men's nervous systems, the 3, 6, 4, and 8 create a much more calm nervous system, less anxiety, because we've got longer to have the full oxygen exchange. Whereas with the faster one, we have less residual oxygen, more CO2, and it kind of feels more like an anxious breath, you know? So for my ladies, I literally don't, when I'm working with pelvic floors, use 2 and 4, ever.
Abby,
Yeah.
I found with the second set, the breath part of it difficult. I didn't feel very comfortable. It was too fast. But the actual, at the end of the apnea, I wasn't gasping in the same way that I find with the first set.
Yeah, so you've got less residual oxygen in your system, so you might find that you're more ready for the oxygen.
Ready for the
than you were.
And with the first set, I take it that's something with practice you're trying to get away from, that gasp at the end of the apnea.
Yeah, you've also got the thing is, so you'll find that you'll almost open your ribs wider with the 3, 6, 4, 8 than the 2, 4, because you feel less panicked in your system. So you'll find that the diaphragm will have drawn down more, so you'll have created more of a vacuum. And so over time, so just before you do your inhale, if you're finding you've got that, just before you do your inhale, I'd like you just to take a little swallow. Or move your neck from side to side, because what's happening is the epiglottis is drawing down, and it's that tension that you're feeling that you're having to release before you breathe. And that's what's doing it. Yeah.
Okay.
So try that the next time.
Okay. Thank
Abby,
you.
quick question for you.
Yes.
So obviously we can do this exercise in a class session with our clients. I know my clients are going to ask me, how should they do that as homework themselves? And if so, should they do it every day? How, I need to.
So the apnea and postures, when we put the postures in, so the posture is just as important as the breath, and just as important as so all the components working together. So if you were even to put this into a little Pilates routine, and I'll go through a couple of, you'll see how you can put it into Pilates as well. We're looking for people to do it for 10 minutes a day. So they regularly do it for 10 minutes a day, and it's the regularity and the consistency that's important. So my ladies who say, oh my God, I totally missed 2 days, and then I just couldn't fit in 30 minutes. I'm like, I don't ever want you to fit in 30 minutes. I'd rather it was 10 minutes consistent practice a day. And if you skip a day, no self-flagellation. It's just just get your 10 minutes back. Yeah.
Brilliant. Thank you very much, Abby.
That's all right. That's okay. So it's just that consistency of practice with the breath work that's super, super important. And if you start, so for example, if you did your 10 minutes in the morning of the breath work with a few postures, then what that does is it informs your rib cage and your posture for the rest of the day. So we prefer people to do it in the morning. They do it, and we're resetting those goggly tendon organs with the posture patterns we're choosing, but we're also resetting the kind of mind-body connection with the breath work. And the hope is that people will start to use their ribcage a little bit more during the day, less upper chest breathing and less straight into their belly breathing. And we're not looking for them to extend their ribcage as much as we do during practice, but we're looking for the ribcage to have a constant little engagement throughout all our breath cycles. Yep.
So when you've got people, when you're doing it on a regular basis, you want them to change the position as well in the 10 minutes practice, or just stick with lying on your back to begin with and then progress to sitting, or mix it up each day?
Mix it up each day. So I give people, after a couple of sessions with me, they have a little 10-minute flow that they'll do, and we're gonna see how, because at the moment you just know the static active positions, but what we're going to do is start moving then. So you could just do a little mini standing flow with all the movement we're going to put in, or you could give them a little combination of poses that do loaded to unloaded to neutral. But initially, for the first session, they'll probably only have done supine and the breathing, so they'll just practice that for the first time. Yep.
Could you use this as well, like the one on the right, for breathing, for like cycling? Because I've been trying to do this with my cycling for a while. Not exactly the same, but similar. And it's terrible.
Yes, so the one on the right, it's for cyclists as well, yeah, to build your CO2 tolerance. So yes, you could use this for your training.
I need a lot of practice. Like, it doesn't work when I try and do things with it. Definitely not in that way, so I'll have to work on that.
Yeah, but starting just as a static pose and then adding movement in once you're comfortable with it as a static active stretch pose, and then adding movement in. And then once you start to add the movement in, so what happens is when we start to add movement in, we start to use the residual oxygen up quicker. So people will find that their apnea time, their rib stretch time changes. So they might have been able to hold for like, oh, I can totally hold for 16. And then we're going to start moving them during the breath work. So there's going to be less residual oxygen when they come to do the apnea breath. So we're slowly playing about with how much oxygen, how much CO2, we're playing with it, I guess is a good word. Okay, so the amygdala is what I'm trying to get to with my slow breath work. So the amygdala is our limbic system, is part of our limbic system, and it's on both hemispheres of our brain. This is where our emotions are given meaning, and this is our deep fear center or emergency center in our brain, and really dominates our fight or flight. It's there because it was there to improve our chances of survival if we were being hunted, either by an animal or by another tribe. So when you are in fear, your amygdala automatically sends out signals to release the stress hormones, so cortisol and adrenaline, of which a lot of my ladies are pumped full of because, you know, they're working moms and they've got this and they've got this huge list, and, you know, and this adrenal fatigue and this cortisol and massive adrenal bursts that they've got all the time are really affecting their pelvic floor, because if they're constantly in fight or flight or constantly in freeze, so the two ends of the polyvagal system, if they're in freeze or constantly in fight or flight, then they're going to be in a position where their pelvic floor is not able to operate optimally because the nerves are not being fed enough through the blood supply. A lot of my women who come to workshops when they've had no experienced hypopressives before, they go home, and if they have sex that evening, they send me messages going, "Oh my God, I had the most amazing orgasm," and it's because the slow breath work that we've been doing has been feeding more oxygen and blood supply, more oxygen into the blood supply towards their genitalia, especially if there are people caught in fight or flight or freeze. Where this area has been it's just been given essentials, but not been given its full amount, a dose of oxygen and pumped full of blood on a regular basis, because they've been stuck in like protection, I need to run away mode, or complete protection, I'm in freeze mode. So this amygdala response is triggered by emotions like fear, anxiety, aggression, and anger. Any questions about that? Cool. This is why I always say soften the eyes, or soften the eyes, or look at pretty things or something nice while you're doing this. You know, don't look at your phone, or don't look at, you know, and really get into the breath work and almost count it in your own head. My clients say they just hear me counting when they do it, because we want them to be really in their bodies, so they're not associating, oh my God, I've got this massive list to do later on, because that's going to keep them in these two areas. And we really want them to come to more of a balance and a homeostasis within their bodies. So why is focusing on mindful breath so important for health? So this is a study. The results have indicated, there's been loads of studies, but this is just one of them, that attention to breath was effective in regulating aversive emotions. Left dorsomedial prefrontal cortex was associated with attention to breath in general. A frontal parietal network was additionally recruited during emotional stimulation. Attention to breath down-regulated the amygdala activation and increased amygdala prefrontal integration. So you start to be more reasonable with your responses and don't just immediately go, oh my God, oh my God. You know, it's like, calm down. I can do this, 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 this. You become much more organized. So increased integration. And such increased integration is being associated with mindfulness ability. Results suggest amygdala dorsal prefrontal cortex integration as a potential neural pathway of emotion regulation by mindfulness practice. So we know that attention to breath, slow breathing really helps to calm down that amygdala response, gives us a better organized brain that will send the right messages to the rest of our body. And this is super, super important. So are there advantages and benefits to holding your breath? So we know from, especially Wim Hof has been amazing for this. So all the work that Wim Hof has done on breath holding has shown us that certain techniques, some of which include holding your breath, may lower inflammation. So we know, I mean, he does it to an extreme when it comes to stress response and inflammation, but we're doing it on a much smaller level and we're not eliciting a stress response. So Wim Hof is very much eliciting that stress response. It becomes very much like hyperventilating with the breath work. And there's a reason for that, because he's looking for it to lower inflammation and do all this sort of thing. He's not looking at trying to balance and homeostasis of the nervous system of overwrought women. So, which is what I'm trying to do. But we do know from his studies that the work that we do will also help lower inflammation. Some preliminary animal studies are also showing that holding your breath may help to regenerate damaged brain tissue. Some breath exercises that involve holding your breath for several seconds can also be part of regular relaxation practice, which again is what Hypopressives becomes for most of my clients. It may also help you to improve your the health of your cardiovascular system. Now, the reason for this is that the whole idea that the diaphragm, the heart, is kind of above the diaphragm, and the heart is actually covered in fascia. It's absolutely amazing. It's totally covered in fascia, and the fascia actually goes into the diaphragm. So they're connected together through their fascial connections and other things. But if we just do upper chest breathing and negate the diaphragm mobility and don't use it very much, then we're not going to have the same movement pattern that's going to help with heart health. If we just push straight down through the diaphragm and don't really create that stretch and engagement of the diaphragm, then we're also going to be negating our heart health. However, if we come from our diaphragm being like this and our heart's up here on top, totally smothered with fascia, as we inhale, stretch the diaphragm out, we're also stretching all the fascia around the heart. We're drawing the heart down. So we're massaging it as we draw it down, and then we're moving the heart up as we exhale, again massaging the heart. So we're getting a beautiful massage through the cardiovascular system. We're also engaging, if we're doing this beautiful stretch out of the ribcage, we're also engaging all the fascia underneath the diaphragm. So all the abdominal tissues that are all connected in with the diaphragm, and also the lymphatic system. So we're getting a gentle squeeze of the abdominal lymphatic system every time we breathe. So we're improving our lymphatic drainage, we're improving our heart health, we're improving our lung function, and we're improving our prefrontal cortex to amygdala connection, which also connects all the way through to our pelvic floor. So attention to breath and slow breath work is essential for our pelvic health and also our whole body. So this is an exercise I do a lot with my class. And again, this one we did originally, but I did this when we first started with our breathing with the apnea breath. And this becomes more and more comfortable, but it's a great way for people to really, I start people on this breath before they even go into an apnea breath. They start doing 3 slow breaths and then pause and do nothing at all. They just wait in the space between breaths. And the reason for this is because until people can hold in the space between breaths for about 8 seconds, there's very little point in them doing the apnea breath, because the apnea breath is going to feel too hurried, too rushed, and too much anxiety. So I don't want anxiety. So I want people to feel super comfortable in the space between breaths, and then I introduce the apnea breath. But to start, if I've got a client who comes to me and they do their 3 breaths, I get them to close their mouth and nose, relax their eyes, relax their shoulders, relax their body, and they can literally hold for 3 or 4 seconds, there is very little point in me taking them to the next stage. And this can be because of near drowning, strangulation by big brothers. Do you know what I mean? It could be for so many different reasons why people panic when they can't breathe all the time. But teaching them that it's safe is one of the first stages in helping them to actually start utilizing their breath better. Okay.
Question.
Yes.
So that one will be fine for my heart clients.
Yes.
Yeah.
Yes. Perfect for them. Yes.
Brilliant. Okay. Thank you.
Yeah. Totally perfect. And really nice and relaxing for them too. Yeah. So evidence is mounting that hypoxia conditioning can be exploited to promote healthy brain aging. So also helping people age well, and may be protective in age-related neurological diseases, including dementia, Parkinson's disease, and Huntington's disease. At present, hypoxia conditioning represents a promising synergistic and complementary approach to exercise and dietary and pharmacological strategies to improve brain aging, and is also a potential alternative to exercise when a patient's physical condition restricts or precludes physical activity. So I've used this a lot with MS, with multiple sclerosis. So if people are stuck in wheelchairs, they can still, one of the big things with MS is the reduction in the mobility of the thoracic spine. And so I've used this a lot pre-COVID with MS, because I used to go to the MS Society, but now they've got some physios who've been trained by me, so they do it instead. So again, if you've got a demographic where you've got some people who can sit on chairs and can't move very much, some people can move quite a lot. You know, if you've got this in a class scenario, then you can use the breath work and the apnea breath for those that can perhaps not get to the floor and do the exercises, so they can still be involved, and maybe they can just do the arm movements while sitting in a chair, but not do the rest of the movement with the class. So it's the breath that ties everything together. So we're going to get rocking in a minute. And the reason that we're going to be rocking is because of this. Rocking has been shown to reduce stress. It improves balance, blood circulation, and also reduces muscle pain, anxiety, and depression. This is because it activates the parasympathetic nervous system, calming the sympathetic fight or flight and bringing us to a more stable ventral vagal state. When we rock in the quadruped, maintaining a neutral spine, we isolate hip movement that can become replaced due to bad posture or lack of movement by the lower back, creating pain. We're also activating a huge range of muscles. This is quadrupled when we add in the further functional movement pattern of push and pull. So we're going to do this shortly. We're going to have a break first for peeing and stuff though. All the other ones after this, all these cues here, all those slides afterwards are all to do with the poses we're going to look at. So these are all the things we're going to go through. So just as an overview before we break, we're going to start standing with rocking. Then we're going to do arm mobilization and neck mobilization. And these are all the reasons why we're doing that. So we're mobilizing our arms for nerve flossing, scapular girdle strength, latimus dorsi engagement, pre-warming up the serratus anterior, mobilizing the arm-to-arm fascia line that connects into all the others, mobilizing the chain of nerve complexes, brachial, cervical, sacral, and pelvic. There are arm cues for you for later, so you can look back, so you don't have to remember everything. And there are some pictures of all the different positions we are potentially going to come to. We're going to look at Artemis and Tahara, so we're going to look at the spine curve in hypopressives and how that's different from a roll down. We are going to look at, so we're using it as thoracic flexion, but also lower back flexion as well. And some pictures for you to look at. This is Vadim, he's one of my colleagues. And we are going to look at using these positions to move between poses. So we're going to look at transitions. We're going to look at quadruped Gaia Maya. We're going to look at them in all different ways, all different movement patterns. We're going to try and do all of these today. And there's some nice pictures for you to follow. And we're going to look at Maya and all the pictures for you to follow there. Hopefully I cover everything. And we're going to look at crawling. And then we're going to look at ISIS just briefly. I'll get you to draw a little stick figure on it, or there's a picture over the page. This is the lowest quadruped position. And we're going to use that, that's in the top picture here, but without your legs crossed. And we're going to use that as a transition into our hestia, which is our sitting pose. And this is the cervical principle, but we're going to learn that standing to start with, and then we're going to bring it into some of the other poses. And then we're going to look at the red light, green light to release stuck posture patterns. And then we're going to look at rotation. Now, rotation can be a very powerful tool. Oftentimes it's neglected in postpartum recovery. So when done safely, it can create more space in the body, strengthen the deep core muscles and fascia, help you connect better to your body, improve posture. Injury can occur from rotational movement when twisting occurs suddenly, and the lumbar spine does all the work. So we're going to use the whole body. Because of this, rotational movement is often avoided in postpartum exercises. If you learn to lengthen and gently rotate whilst ensuring you're breathing correctly, you're good to go. This is such a fun movement pattern to do too. Rotation can create a fabulous deep core connection and help prevent diastasis recti, abdominal tearing, and low back pain. So that's our Cellini pose, and there's some cues for that as well. And then, ta-da! We're done with the slides. So from now on, it's all going to be practical. Any questions about the slideshow or about what you learned in that? And then we're going to take a wee 15-minute break so you can have a pee and get glasses of water and do all that sort of stuff. Any questions? Everybody okay?
Where did all the names come from? Why was it decided?
So they're all goddess names. So Tamara, when she was creating this from right back when it became from just regular hypopressives from Marcel Caffrey's, when we started to mobilize them, it was like thinking about what to name them so that we had like a common name that all the trainers would use rather than just like the bent pose or the bent over pose. So she wanted to really give them strong female characteristics. So she chose goddess names, and and this has been an issue for some of my American clients and some of my clients who are very religious, because because they're goddess names. So if that is your leaning, then you're welcome to call them bent over or kneeling or whatever. But they're there because they represent strong females. They're either warriors or virgin queens, or, they've all got like some sort of strong status, and they're from both Greek and Roman and a Norse legend. So that's where they come from.
One other question I wanted
Yes.
to ask, well, slightly away from the goddess part, is you were saying that some of your clients had better sexual experiences after doing the breathing. Same with erectile dysfunction for men?
So erectile dysfunction for men gets better as they do hypopressive practice. So not necessarily immediately, but it is something that comes over time, because quite a lot of the time it's been damage done because of the prostate removal. I haven't had any men who've come to me without having prostate removal. So actually, I've got one guy now. I can ask him, Sarah. I'll ask him.
Just intrigued.
Yeah, I'll find out.
Why would it work for men?
I'll find out and I'll let you guys know, because yes. I'll ask him. I'm seeing him on Monday morning, so I'll ask him. I was going to say his name there, and I'm not going to say his name. I'll ask him on Monday morning whether he's had he'll think that's really amusing. He's quite young, so he's coming to me because of connective tissue disorders. So he has erectile prolapse because he's really hypermobile. So that's why he's coming to me at the moment. But I'll ask him how his erectile function has fared and see what he comes back with. Okay, everybody, so we're going to have a 15-minute break. So we'll be back I'm just going to check my clocks right. We'll be back at 25:02. And we will get started moving. So we're going to start standing moving. So just so you know where we're at, we're going to do a little warm up and then we're going to get straight into it. Okay, I'll see you all in 15. Okay.
Oh, yummy. Bjorn. Come, you're going to Malcolm in about half an hour. Come eat. Give me back my phone now. Okay, then I'm gonna have to come and get the phone from you. No, come. Now. Then I'm gonna have to come take it. I've given you warning. I'm busy building a top story made out of Yeah. Sorry? I just ate what do you call it? The ends, but you don't like. We've still got lunchbox snacks. I might want this. Oh, try.
Take a little bit, a little back.
Oh, so you can warm. Oh, get peanut butter. Peanut butter and jam on the Back to lunch. Which one? Delicious.
Wow, sandwich. Manageable.
Remember that you were not left to school and I. And I just eat everything in my life.
Hello, we're back.
Abby, could I just ask quickly, are we supposed to have printed notes to this day. I've had them for the first one, but I didn't get anything for the second.
Yes, you should have done, Jackie.
Okay, I can ask them for that on Monday.
What I'll do though is I'll send you out, this is an electronic one. And I'll
Okay.
do that today after the session, so you got it as an electronic one. Did
Brilliant.
everybody else get it? Yeah. Okay.
It could come in
Well,
the post today.
What I'll do is I'll send it out straight after this, Jackie, so you've got it.
Thank you very much.
That's my pleasure. It's fine. I'm going to send you out the video as well, and I'm also going to send you out some extra help. And also, I've got a little bit on my website with instructions for, well, extra help for you guys as well. So I'll send you out a link to that too. So there's loads of help. Because essentially, I'd like you to really understand this to its core. So I want to give you as much help as possible to do that. So again, even after this is finished, if you've got questions, just fire them at me, because I'm like very receptive, because this is taught so wrong in so many places that I just would like everybody to be able to integrate it into what you teach, but do it really, really well, you know. So, which I know you'll all be great at, so it's all good. So we're going to start standing, and we're going to do a warm-up for our body. It's going to incorporate lots of different things for moving it. So the first thing we're going to do is look at our feet, which we did when we did the first session. There are lots of different fit exercises. I do rolling balls and things, but getting people to individually move their toes is quite a big thing. So it's also really important for posture, for gait, for so many different things, that people have functional feet, and a functional big toe is a massive part of that. So we're going to start by stretching your feet nice and wide, keeping our knees soft, and having our feet pointing straight ahead. I'm just going to mute you guys, and then you can unmute if you want to talk, because it means that it won't jump about. But you're free to unmute, and please ask questions whenever you want, yeah? Okay. So we want feet point straight ahead. The reason for this is this: if you angle your feet in the way, you'll feel the back of your pelvis contracting as the front of your pelvis opens. And this is both for the muscles, but also for the bones in the pelvis. And same the opposite way, if you put your toes together, you're going to feel that contraction at the front and the widening at the back as the sit bones are pushed wider by the internal rotation of the femur. So we want feet straight ahead. And I'd like you to just feel an even weight between the underside of the big toe and the underside of the little toe. So yeah, the parent, I should really think about the anatomy for that. The heels, the inside and outside of the feet. I'd like your toes to be quite nice and relaxed. Then we're going to lift the big toes up, pulling them towards each other, not towards the foot that they come from. So as you lift them up, you want to really feel like they're moving towards each other. This helps to stop bunions as well, if we can have the toes so they're functional up and down like this. Then we're going to lift all the toes up and place just the big toes down. Again, still trying to pull them towards each other, but also to press them down a little, so we're getting a little bit of work into the big toe. Then lift all your toes up and place the little toes down. Good for all that. I don't think I need to speak to anybody in Wales just now. So toes up. You've had an accent. So little toes down, then little toes up. Then we're going to put the big toe down, and then the little toes down, trying to keep the middle three up. Good. And then shame on my way. It's like, looking is really important to start with, because we're creating quite often new neural pathways, or pathways that have been lost. So we're reintegrating how making our feet move, and using your hands helps too. So let's try that again. Big toes up, pull them towards each other. Then swap it over, big toes down, other toes up. Then all your toes up, little toes down. Then all your toes up, big toes down, little toes down, middle three up. And then shake them off. And then stretching them nice and wide, we're going to do a Mexican wave with them, starting with the big toes, and then slowly lifting. So do it as slowly as you can. Each individual toe up until you get to your little toes, and then going back the other way. Little toes down all the way to the big toe. My clients have challenged me to try and lift my little toes up first, and it's a work in progress, but it's getting there slowly. So it's just another like horrendous thing to try and learn. I always have clients challenging me, which is fine. I like a challenge. So let's try that one again, Mexican way. So big toes up, and then each individual toe up, and then little toes down, each individual toe back down, like you're playing the piano. Then we're going to take a back of the foot stretch. So we're taking the dorsal section of our foot and placing it on the floor. This has got a couple of reasons why we're doing this. Oh, this helps to open up into the hip flexor, which is a great reason. We want to make sure the heel is in line with the back of the leg. Pelvis straight ahead. And take a nice breath. And then swap and do the other side. Hardly ever stretch this part out, so it's quite nice for people to do it. It feels good to feet, especially for my runners. And then back to the start. Okay, so the next thing we're going to work on is getting some more movement into our pelvis. So we're going to start first of all with bending our knees, and we're going to look at all the different planes of movement that we use when we're walking, but as individual parts. So we're going to start by tilting our pelvis backwards and forwards. And that's, we've got our knees a little bit soft for this one. So really backwards and forwards, moving through this frontal plane. Good. And then we're going to come to roughly the center. And then I'd like you to push, so coming back to kind of almost straight legs, push your pelvis over to one side and then the other. Good. So really feel like you're isolating and pushing the pelvis. Okay. We're going to do this for another 4, 3, 2, 1. Then we're going to hike the pelvis. So we're going to lift one side, then the other side. So what we're getting here to do is our bones to move in different directions. And as our bones move, our muscles move. And as our muscles move, our connective tissue moves. And we're getting a bit more movement and juiciness into our pelvis. Then the next movement pattern, we're going to push one side of our pelvis forward and then the other. So we're rotating. So pushing forwards, forwards, forwards. So it's quite hard for my clients to isolate. So instead what we do is we step forward. So we step forward so the toes are pointing this way, and step back so the toes are pointing this way. So stepping forwards, stepping back, stepping forwards, stepping back. Let's do 2 more, stepping forwards, stepping back, 1 more, stepping forwards, stepping back. Let's get a bit more motion into the pelvis, and then do the other side, same thing. Forwards, back, forwards, back, forwards, back, forwards, back. You feel those pelvis, you can put your hands around your pelvis so you can feel that movement. And let's do another 2, and 2. I'm bringing it back to the front. Now I'd like you to imagine your coccyx as a pen, or a pencil, or a fountain pen, doesn't matter which. And you're going to draw a figure of 8 with your coccyx. Good. So as you draw the figure of 8 with your coccyx, your whole pelvis is going to be drawing that figure of 8 as well. And you'll notice, if you think about it, that as we draw this figure of 8, we're using all those planes of motion. We're tilting slightly forwards and back. We've got our side to side. We've got our pushing the pelvis one direction and the other. Now go the other way with your pelvis. So think about using it in a different direction. I'm totally going the same way there. So trying to do it the other direction. And then I'd like you to slowly make your figure of 8 smaller and smaller and smaller until you are balancing in the center. And hopefully your pelvis feels a little bit more weightless than it did at the start. We should have tested that first. I'm terrible for not testing first before we do things. So now I'd like you to take a nice deep breath. I'd like you to feel how your ribcage feels. And then let it go. And just feel if you feel any restriction. So take a couple of breaths. Where do you feel restriction just now? We're going to see if we can improve this with a bit of mobility. Okay, so now we're going to rotate. We're going to rotate, holding your ribcage. I'd like you to rotate one way and then the other. And I'd like you to notice how your ribcage changes shape. So the side you rotate towards becomes more pointy, and the side you're rotating away from becomes flatter almost. Okay, and everybody's ribcage is slightly different shape, so everybody will feel it slightly differently. But the important thing is the change. The fact that it becomes a little bit more pointy, the side you're rotating towards. So I'd like you now, as you rotate and breathe, to squeeze that side a little bit. So every time you rotate, squeeze the side you're rotating towards. Just with your hands, just give a little squeeze. So this is great for improving the tonicity in the diaphragm, but it also helps the pelvic floor. So there's a double-edged reason why I use it. So squeezing. And you'll also notice that as you rotate, your pelvis helps with that, or it is combined with that. So we're not trying to hold the pelvis tight ever. We're just allowing the pelvis to follow what the rib cage is doing just now. Okay, now coming back to the center, we're going to move our rib cage. So most people have real restriction in the back of the thoracic area. So we're going to move our rib cage in all the different directions. So first of all, we're going to push our rib cage forward and then pull it back. And push it forward and then pull it back. So really using the rib cage, pushing and pulling. Pushing and pulling. Good, we're going to do another 2 here. And then we're going to push our rib cage over to one side and then push it over to the other. Push, push. So we're going side to side. Push, 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 and back to the center. Now I'd like us to do a big circle. So we're starting forwards, then going to the side, then going back, then going to the other side, and then coming forwards. So really doing a circle all the way around those different movement patterns. Good. And at the same time as doing this, our pelvis is also joining in a little, and our spine. So we're getting a really nice mobilization for our spine before we get started. And then going the other direction, so circling in the opposite direction from the way you've been circling. You can hold your rib cage if you want, or you can have your hands by your side, you know, whichever feels nicest for you. We're going to go around for another 2 circles and then bring it back to the start. Excellent. Then we're going to think about our neck, because our neck is all connected into everything we're doing. So we're going to tilt, oh no, arms, shoulders first. So we're going to do hands crossing over. So just really allowing it like you're dancing through puddles as a kid. Just feeling a little bit joyful about the movement, allowing the body to move. And then slowly allowing that to get slower and slower and slower and slower until you're just hanging. Good. Then for the neck, we're going to take the neck over to one side. We're going to take the other hand and place it on the ear. We're just going to draw it down a little. Then I'd like you to tilt the head so you're looking a bit underneath the armpit and pull the other arm away. Good. And then release. And same on the other side, tilting the head first, hand, tilt the head towards the armpit like you want to sniff it, and then pulling the other hand away. Good. And just allowing that little stretch through the neck before we begin. And then come back to the start. Okay, so we're going to start with a very basic posture pattern for standing, Athena and Venus, and then we're going to move into moving them. So just as a recap from last time, so feet are hip distance apart. Hopefully you feel like your pelvis feels much freer than it did when you started in your rib cage. So knees are nice and soft. We want to balance our pelvis on top of our femurs, so just remembering that little figure of 8 and maybe just giving yourself a little wiggle through the figure of 8 again, just to find that position. Finding the rib cage balanced on top of the pelvis, so making sure that it's not pushing forwards, pulling back or off to one side, so it's nice and even across the top of the pelvis. The head balanced on top of the shoulders nice and relaxed, chin horizontal to the floor. And then we're going to shift the balance point towards the front of the balls of the feet. Still engaging the heels with the floor, toes are nice and soft. I need to feel like you're almost growing roots into the floor with the heels and the head is reaching away all the time. Sacrum also dropping gently towards the floor. Hands down the side of your legs, pulling them out as if somebody's gently resisting into our neutral position. Good. From here, I'd like you to rotate your hands so your wrists are rotating and your elbows and your shoulders so your palms are facing behind you. We're going to extend the wrists and place our hands into our first position, just gently pressing out through the elbows. We're going to do 3 nice slow breaths in an apnea here to warm us up, and I'm going to give you a count of 3 and 6 for this one. So ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose, pause, and slowly widen your ribs. Take the slowest time as you can. If your fingertips are really close together, try and pull them apart a little bit, just to give you a little bit more space across your chest area. Good. We want to have almost like a circle, like a hula hoop here for our hands and our arms. When you need to inhale, inhale here, but keep the active stretch through the shoulder girdle and rotate your hands so your palms come out into a V. So in this V shape, we can either have our fingers stretched for more nerve activation, fingers together for less nerve activation, fists for very little nerve activation, depending on what our clients are looking for. So from here as well, as you gaze forwards, wiggle your fingertips and make sure you can see them in your peripheral vision, so we're not winging behind us or hyperextending through our elbows. 3 breaths here, ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs slowly and just taking your own time over this, slowly widening, thinking about them widening to the sides, behind. Think about that sternal mobility as well. Think about the fingertips reaching away, the sacrum to the floor, the head to the ceiling, the relaxed jaw. When you need to inhale, inhale here, and exhale, release. Okay, so that's a little review of the first little bit of our active stretch in Athena and Venus. Now we're going to add some rocking into this. And this again is to engage our parasympathetic nervous system more, to calm it down. It's also to help us from falling, create better balance and proprioception. So we're going to start in our forward position. We're just going to have our hands by our side for this first one. We're going to start adding arms in a minute. As we inhale, we're going to shift the balance point back towards our heels, still keeping our toes nice and soft and on the floor. We want to make sure our knees stay soft as we rock back. The reason for this is, as you rock back, things that can go wrong with this can happen, or we can lift our toes off the floor and we can start falling backwards. What I'd like you to sense in your body is this. As you rock backwards, I'd like you to sense the anterior chain kicking on to kind of hold you, to stop you from falling over. So that moment where it goes, you have that swap over between the posterior and anterior chain. And then as you exhale, I'd like you to shift your balance point back forwards. Again, witnessing that moment where the anterior chain kind of lets the posterior chain take over to hold you from falling forwards. So we're just working between those 2 points, anterior on, posterior on. I mean, they're both working all the time, but we're just a little bit more engagement as we go backwards and as we go forward. So really sensing that when we move. Okay, have a little practice first before we add real focus on the breath back in. Okay, so now shifting your balance point forward. As we inhale, we're going to shift back towards the heels. As we exhale, we're going to shift forwards towards the front. The reason for this breath pattern, the inhale back, exhale forwards, is because we want to end up forwards for our apnea breath. So we're inhaling, shifting back. We're exhaling, thinking about the heels going into the floor, the head going towards the ceiling as we come forwards. Toes stay soft. So we're going to do 3 of these and then our apnea. So let's start forwards. And I'm going to count you 3 and 6 again. So ready to inhale and shift back. In, 2, 3, forward. 5, 4, 3, 2, 1. In, 2, 3, forward. 5, 4, 3, 2, 1. In, 2, 3, forward. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Slowly widening your ribs. As you widen your ribs, thinking about that soft jaw, the heels and sacrum moving towards the floor, the head moving away, the shoulders nice and wide, the relaxed eyes, the relaxed knees. When you need to inhale, just inhale here and exhale, release. How's that feeling in your bodies? It's nicer when we start moving, eh? So let's start with our hands. We're going to add some arms in. So we're going to start with our hands out towards the side, palms face forwards. Good. Make sure you can see them in your peripheral vision. As we inhale, we're going to rotate our hands and bring them into first as we shift back. As we exhale, we're going to open them up again, always moving from the distal point first, so from the wrists, the elbows and the shoulders. As you exhale and come back, you're going to rotate wrist, elbow, shoulders as you come back. Inhale, coming forwards. Good, and at the end of this third one that you're doing, you're going to perform your apnea. I'm going to count you for the next set. And then we're going to come forwards. And then you're going to pause when you're ready and start your apnea breath. Remembering as you start your apnea breath to think about the heels, the fingers reaching away, the shoulders wide, the relaxed jaw. Good. And when you need to breathe, breathe. And give your legs a wee shake off, like don't give them a shake. It's nice for them. Okay, so we're going to go for this again. This time I'm going to count you, and this time we're going to progress it. So we're going to do 3 sets. The first set, we're going to inhale, come back, exhale, come forwards, and we're going to do 3 of these. The second set, we're going to exhale, come back, internal rotation, exhale, come forwards into our T, and then our apnea. And our third set, we're going to rock back, internal rotation third, and then rock back forwards into our external rotation.
Abby, are you recording this?
Yes, it is recording.
Is it?
Yeah.
Okay.
Yeah, it's definitely recording. It says recording at the top of my screen, so you'll definitely have a recording. Yeah, phew, just in case I've forgotten again. So we're going to shift the balance point forward onto the balls of our feet. Good. And we're going to start with our hands out towards the side, palms face forwards. And we're going to start internal rotation as we come back. We're going to reverse this for the next set. So ready to inhale and shift back. In, 2, 3, forward. 5, 4, 3, 2, 1. Rotate back. 2, 3, forwards. 5, 4, 3, 2, 1. In, 2, 3, back. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Rock back, internal rotation. 2, 3, forward. 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Rock back in third. 2, 3, forward. 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Inhale here. Exhale, shake it off. So we are talking to your parasympathetic nervous system with the breath. We're mobilizing your pelvic floor with the breath. We're talking to your sympathetic nervous system with the rocking. We're also engaging your pelvic floor with the rocking. We're also switching between posterior and anterior chain for our fascial and muscle chains. And on top of that, we're mobilizing the ulnar, radial and medial nerve through the rotation of our arms. This is causing a cascade effect into your central nervous system and into the plexuses that go down the back of your spine. So you have your cervical plexus, you have your brachial plexus, you have your sacral, you have your pelvic plexus. So we're looking at all of those as well, all the way down the spine. So we're getting this a vibration that goes all the way through the body. Any questions before I add?
Is it normal to feel quite tired when doing those?
Yes, to start with, you might feel a bit tired because because of the oxygen and the CO2 exchange going on, and there's a lot going on. When we start to move these poses, Joy, we're starting to use a lot of the residual oxygen in our body through the movement. So when we come to do the apnea, there is less residual oxygen in there than if we were just standing doing an active stretch.
Yes.
So you may find that it feels a little bit harder to do the apnea. Is that what you're
So
feeling?
it's more to do with the oxygen than to do with like feeling calm, I guess.
Yes.
Because of the movement. Yeah, it's the oxygen that's creating that. Yeah. Okay, thanks.
And as you become more comfortable with it, it'll become much more, regulated.
Bringing more energy. Yeah, okay.
Yeah.
I found, I must say, the standing up, lying down is one thing. Standing up, I can get breathe out for 5 seconds and I'm like, oh no, this is panic hitting and it's horrible. It got better by the end, but lying down is one thing, but standing I find much harder.
And there's a reason for that. So the diaphragm is working as both the postural muscle and as a breath muscle and as a stabilizer. And especially when we start rocking, because when we start rocking, we're shifting our body about. So the diaphragm is trying to stop us from rotating, and it's trying to stop us from falling over too. So it's not just working as our postural muscle, but also as a stabilizer the minute we start to rock as well. So we are getting a load of toning happening within the diaphragm. And again, that's going to affect how you feel to start with and how long you can hold your apnea and how long you can exhale for.
The out breath on the longer part, obviously it's a long out breath, is mouth breath, isn't it, rather than nasal?
To start with, but if you are comfortable if you can manage to maintain a relaxed jaw throughout the exercise, then I'm very happy for people to nose breathe because it's much better for us. But the reason that we do the relaxed breathing through the mouth to start with is to ensure that everybody has a relaxed jaw, because I don't want any tension in the jaw at all, because that's going to create tension in the pelvic floor. And that means when we try to, when our body is trying to widen the pelvic floor on the inhale and close the pelvic floor on the exhale for this eccentric and concentric contractions, it's going to find it much harder to do because the pelvic floor is going to be like a little rock. So it's not going to be able to stretch as easily as it could. And then when we come to do the apnea, the fascia is going to struggle because it's also being held tight. So the pelvic floor is not in a functional place to be slowly drawn up. We're going to have too much tension. Any other questions? Did that answer that? I hope that.
Yeah, Abby, is it normal to feel tingling in your feet?
Yes.
Okay.
So we got as we start rocking, we're creating more proprioception through the nerve endings. We have 250 to 300,000 nerve endings in each foot. So yes, starting to feel a tingling or an activation is normal. Yeah.
Okay, thank you.
Okay. Any other questions? Okay, we're going to reverse it. So this time, instead of coming backwards, we're going to do the breath the same way, but we're going to reverse the way we use our arms. So instead of coming back in internal rotation, we're going to start an internal rotation and we're going to come back into external rotation and come forwards into internal. And just give you another go at this. So we're going to do 3 and 6 for the breathing. However, if you're finding it too long, the breath, then please just breathe at your own rate. I'll count 3 and 6 for the purpose of kind of keeping us together. But if you find you want to move on a little bit quicker, that's also fine. Yeah, just try and keep your rhythm. Okay. So shifting the balance point forward, toes are relaxed, heels are growing into the floor, knees are nice and soft. Find that balance in the pelvis, that feeling. So a little baby figure of 8 if you need it. So you feel like the pelvis is just balancing on top of the femurs. The rib cage is also balancing on top of the pelvis, so give it a little circle if you want to, just to find that space again. Shoulders nice and relaxed, give them a shake out just to feel that they're appendages on the back, tops of our shoulders, at the end of our shoulder blades. And then our neck nice and relaxed too. Shift your balance point forward, internally rotating our hands first, so remember start from the distal point. Good. Okay, then we're ready to rock back. So ready to inhale and open to the sides. In, 2, 3, back. 5, 4, 3, 2, 1. In, 2, 3, back. 5, 4, 3, 2, 1. In, 2, 3, back. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Rock back. 2, 3, 4, 5, 4, 3, 2, 1. Rock back. 2, 3, 4, 5, 4, 3, 2, 1. Rock back. 2, 3, 4, 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Rock back. 2, 3, 4, 5, 4, 3, 2, 1. Rock back. 2, 3, 4, 5, 4, 3, 2, 1. Rock back. 2, 3, 4, 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Inhale here, exhale, shake it off. So we can do it both directions for the arms. Now, we don't always want to work everything in our body unilaterally. If we think about where the fascia slings go and where our muscle slings go, they also go across the body in crosses. So we also want to work alternative arms as well. So we can also do this with our arms. So we can start in a nice simple way to start with. So we're going to shift the weight forward on the balls of our feet. We're going to take the rocking out of it just for a moment and we're going to reel it back in. So we're going to take our hands. So one hand is going to be internally rotated in first and the other hand we're going to bring up to our third position. So we've got alternate sides. And we can use this as a static pose first. So the weight is forward on the balls of the feet. We're going to do 3 breaths in apnea, just holding this position. And then we're going to swap it over. During the apnea, we're going to swap our arms over. So, ready to inhale? Let's go for it. So, holding it here for our 3 breaths. Pressing gently out through your elbows to create that space. Ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs for 10, 9. Moving your hands, 8, 7, 6, 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Start widening your ribs. As you widen your ribs, swapping your hands over slowly. So keep focusing on the widening of your rib cage as you move your hands up into the next position. Ready to go again. And then shake the arms off. Now, the moving, to put this into perspective, the moving during the apnea is a level 3. However, I quite often introduce it quite early on. But if I was teaching you in my usual levels of 1, 2 and 3, this is how it would look. In level 1, it's all active stretch, static positions. 3 breaths in apnea, 3 breaths in apnea, always staying still. Just focusing on the breath work and getting that active stretch through the body. At level 2, we'd move during the breath work, the way we did to start with. So we'd do an inhale, exhale, inhale, exhale, inhale, exhale, apnea. The apnea would again be still. When we come to level 3, then what we start to do is we start to move during the breath work and during the apnea. So we get much more combination going on. But because it's level 2 that you guys are doing is kind of a mishmash with a little bit taken from level 3, I also wanted to introduce moving during the apnea for you. And we've talked a little bit about the nerves that we're using as well. So any questions about that before we move on and add all of that to movement too? Everybody okay? Good. So if we think that we were internally rotated, we could have also done that in external rotation. So we could have done external rotation as a static pose as well. And we could be like windmills. You know, you could inhale, exhale, inhale, exhale, inhale. Think about all the movement you're doing. Exhale, apnea. And during your apnea, you could change over so you're ready to go on the other side. So you've got this ability to be able to use either external or internal rotation. And I teach them always as a static, starting as a static position first, which we're going to do just now. We're going to do this and then we're going to add a bit more movement. And then I add in movement during the breath work, and then I add in the movement during the apnea. So if you're seeing a client, that would be the progression that you're looking for. Okay, because we want them really aware of what they're up to. So let's come to that external rotation as a static pose first. So we're going to shift our balance point forward. We want one arm up in our third position. We're just going to hold this as a static first. And we're going to stretch the other arm away. Now I'd really like you to feel like you're reaching from these fingertips all the way through to these fingertips. Your heels are reaching into the floor too. We've made sure that when we come into external rotation, we've not done this, which a lot of my clients do, that we're still really stretching through the body without the ribcage popping forwards. Chin horizontal to the floor, and make sure if you wiggle your fingertips, you can still see them in your peripheral vision. Okay, and this is especially important for my hypermobile lot. Okay, so let's do it. 3 breaths here and an apnea. And during the apnea, we're going to swap our arms over. So ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widen your ribs as you widen, swapping the arms over for 8, 7, 6, 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widen your ribs as you widen, swapping over for 10, 9, or just as long as it takes you. I've been giving you 8s and then I give you a 10. That's mental. I only need to inhale here and exhale, shake it off. Okay, so let's put that into a little bit of movement in a moment. Does anybody have any questions before I move it into a little bit of movement? Okay, so we're going to shift the balance point forward again. And this time we're going to start internally rotated with our hands. As we inhale, we're going to shift our weight back into our heels and open into external rotation. As we exhale, we're going to come forwards back into our internal rotation. So this is a nice simple way to introduce the rocking with the internal to external in alternates. And then when we do our apnea breath at the front, we're going to swap over and start the other way. So ready to inhale and rock back. In, 2, 3, forward. 5, 4, 3, 2, 1. In, 2, 3, up. 5, 4, 3, 2, 1. In, 2, 3, back. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widen your ribs and swap your hands for 8, 9, 7, 6, 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Rock back. 2, 3, forward. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs as you swap over, taking it nice and slowly. Just feeling what happens to your rib cage as you swap over as well. So as your arm, the furthest arm up, your rib cage will be elevated a little bit more on that side for the apnea. And then shake it off. Okay, so how did that feel in your bodies? What did you notice? What did you find hard? What did you find difficult? What questions do you have?
I had some tingling in my hands when I was when the hands were turned there on my little pinky fingers.
Yeah.
When I was in the apnea part, when I was holding my breath.
So that's because when we do this rotation here, when we're doing this rotation, we're flossing. The minute we extend, we're doing nerve tensioning. So this can be too much for people. And when there's too much tingling going on, we just make a fist instead. So quite often with my ladies, I get them to do the movement part internally and then externally, you know, so they do this, so it's constant movement. But when they come to do the apnea, if this is too much, they just come into a fist for the apnea to take that stretch of the nerves out at the end. And that's
why is it within apnea that the tingling comes on more than just holding the floss position?
It's because we're holding it for longer. So
Okay.
if we're moving, you know, if we're moving it, then we're then we're not holding it for quite so long, but we're holding it for up to 12 seconds here, so it's quite a long tensioning. Whereas the rest of the time, everything is in constant flux. And even when you're standing here and breathing, I suppose when you're standing here and breathing, good question actually, so when we do the apnea breath, we have less oxygen going to the extremities as well, which is why you'll feel it more than if you were just standing doing 3 breaths here. So for the whole 3 breaths part, you might feel it totally fine because there's still oxygen's being fed to the extremities. But when we do the apnea breath, we have that moment in time where we're using up the residual oxygen in our body for the apnea. So that might help explain that a little bit more, Sarah. Okay. And yes.
When I do the rotation through my right elbow, sometimes there's like a popping. It's like there's a ligament or something that runs funny.
Yeah, so into your elbow here.
On the inside.
On the inside of it.
Yeah, so if I rotate and then as I bend, okay, now it's not doing it, but it was doing it earlier.
So it'll be everything starting to move again. So what I do for that is just not bend quite so much to start with, and then introduce more and more of a bend to it. It'll be a ligament that's tight, but I'm going to go away and have a think about that over lunch as well, and make sure that.
No, it makes sense because I am tight to my right side, so it's only happening on my right elbow.
So yeah, so it'll be a tension through here, but I'll try and work out exactly what's going on. I'll have a look at my anatomy inside and do a little investigation during lunch. But yeah, just taking a little bit less to start with and then building slowly rather than coming into a totally bent position each time. The other thing that can happen quite often with people is that they can get a kind of popping sensation in their ribs. So sometimes people get a popping sensation in their ribs, and this again is like the ligaments and the connective tissue here just starting to work as well. So
if there's ever like uncomfortableness or like pain around here,
into this area here, just not holding the apnea breath for quite so long, Maxine. So if we never work with pain, so you can work with it's feeling slightly like I'm working, but the minute you feel pain, you reduce what you're doing. So take it to the point before that happens. I have lots of ladies who try really, really hard and, you know, too hard. So it's about self-regulation as well, learning how to self-regulate. So just making sure that you don't take it beyond the point where you're comfortable. That's really important for your nervous system as well, because a lot of us push beyond that self-regulation point on a daily basis, including myself.
It's difficult from a practical point of view. If you want to rehab any part of the body, sometimes a bit of movement is needed. Well, always movement is needed, but then sometimes every movement is painful. And then where do you go to from there?
So, I mean, I had for a long period of time, I had an injury to my, it wasn't actually to here, but I couldn't unbend my elbow for ages and ages. and I had all sorts of fascial people going at it and things. And it was like actually an osteopath who was like, which way do you turn when you're teaching online? You know, and it's actually trapped a nerve in my neck. And then he did something and it just went bing. But that I found that was the rotation really hard. So if you're finding that the rotation hurts, you keep it in external rotation to start with. So you're still using the fingertips, you're still moving, you know, and you can even go from neutral to external, from neutral to external. So you could do it that way rather than taking it into internal rotation if this is too much for the shoulders. And quite a lot of the time, my ladies who have issues going on with their shoulders, they keep it where it's comfortable for them. So instead of internally rotating as they rock back, they might come up a little bit as they rock back and then come forward, down as they come forwards. So they move within whichever range of motion their frozen shoulders will let them move to. And then as it mobilizes more, they get higher and higher and higher. And then when that becomes really comfortable, then we add internal rotation in. It's about following the body that's there, Maxine, and making adjustments depending on what they need. Yeah. I've had a lot of frozen shoulders in the past with my ladies, but that I'm actually getting less and less because they're so mobilized these days with coming to classes all the time, that fewer ladies are turning up with frozen shoulders. But when they used to come and see me once a week, you know, when I did live classes and it was just once a week in different areas, there were definitely far more frozen shoulders on a regular basis than there are now. They see me online 5 times a week, so yeah. And I think that's probably just from mobilising, because they were only ever mobilising once a week when they came to a 40-minute class. So
yeah, I have a few of them as well, and they come once a week, and it seems like they can move their arms less and less.
Yeah. It's because that's the only time they're moving. In a different way from the way that, you know, we become stuck in. That's what that whole goggly tendon organ thing is about. You know, we become stuck in posture patterns and our body begins to think that's normal, and then we can't take it out of that posture pattern. So the amazing thing also about Pilates and also about hypopressives and also about yoga and other exercise modalities is we're asking the body to move in different planes, but also in different ways, from twisting to up and down to, you know, and constantly asking a little bit more of the body so it doesn't get stuck in those posture patterns. And this is just another way to do it, you know. But you can add this into so many of the Pilates positions as well. And, you know, your imagination will be... I'll show you a few that I've nicked from my Pilates training and put into my classes. Yeah, as we go. So, we're looking at the arms here, but I also want to look at the neck here while we're standing too. So in hypopressives, we use neck extension and we also use neck flexion. Let's look at the flexion first, and we're going to then add it into rocking and everything else. But let's add the neck flexion first. So the whole idea in hypopressives is thinking about the spine and thinking about the vertebrae. So we're always wanting to try and keep a separation between the vertebrae, trying to create space rather than compaction, which is what happens with daily life. It just gets, you know, pushed further and further down with all the, you know, the environment. So yeah. What we're trying to do is always create space. So if we're thinking about neck flexion, we don't want to just nod the chin to the chest, because what that does is it creates a width, a widening at the back of the vertebra, but a shortening at the front. So it comes closer together at the front. So what we're always trying to do is trying to think about lengthening the head away from the feet, and at the same time creating a curl in the spine or in the neck, and in that to create a little bit more of a traction or a stretch of the posterior but also the anterior chain. So we think about our posterior chain comes from underneath our heels all the way up through the back of our body. Remember when we came into this position, we were stretching out that posterior chain. We want to do the same at the neck. So what we're going to do is imagine we've got a little, like a plum, underneath our neck here. So we can never take our chin to our chest. And what we're going to do is we're going to think about reaching the head away and then curling the neck so that there's always a space here. So that we've got there's a real space in the vertebra behind us. Yeah, good. And you're never going to come, you can squish the ball a little, but you want to really feel like this, you're creating a curve rather than a fold. Nice. Good, and we do this position, the flexion, in almost all the positions we use the flexion. We don't use extension in all the positions, but we do use the flexion, although I'm starting to bring it in because I've nicked stuff from plies. But I've got to tell the rest of the team first. So let's think about flexion. So we're going to have our feet hip distance apart, our knees nice and soft. You're going to shift your balance point forward onto the balls of your feet, heels connected towards the floor, head is growing away. You are going to do 3 nice slow breaths. At the end of the third one, so during your third exhale, I'd like you to reach the crown of your head away and come into your curl and then perform your apnea. So you're going to curl on your third exhale. So just taking your time with your breathing, really focusing on the ribcage widening and closing and widening, closing and then widening, and as it closes for that third time, curling the cervical spine and then performing your apnea. So now you're really stretching that posterior chain a little bit more. Good. Once you've done it once with the exhale, I'd like you to try it with the apnea. So I'd like you to feel like it's almost a progression of the apnea. So you're going to do your 3 breaths, and then you're going to start your apnea, widening the ribcage to the sides, behind, into the upper chest, and then as you reach the pinnacle of your apnea, I'd like you to curl your neck, reaching the head away from the heels and curling, and really thinking about that curve in the cervical spine. So remember, shoulders are not coming into it, shoulders stay where they are, it's just that cervical spine. So 3 breaths. At the end of your third one, you're pausing for a moment. You're starting to widen the ribcage, and as you widen the ribcage, you're going to think about the chest also opening a little, and then think about this reaching away of the crown of the head and into your curl. Nice. How does that feel in your bodies? Good. Excellent. Let's add some arms because we're wanting to engage everything. So let's start with our arms in first position, internally rotated. We've got our balance point forward on the balls of our feet. Our chin is horizontal to the floor. Our heels are growing away from us. Our elbows also. Good. We're going to do our 3 breaths. At the end of our third one, we're going to start our apnea. As we start our apnea, we're going to start moving our hands up. As our apnea grows, our arms are going to move up. And then when we get to the point where we start to curl our neck, we're going to bring our hands up into our third position. So take it nice and slowly. 3 breaths in first. So 3 nice slow breaths. Whenever you're ready, you're going to start your own breath pattern because there's a lot to think about. At the end of your third one, when you come there, you're going to pause. Slowly start the widening of your ribcage as your hands also start to move up. Good. And then as your hands get to about where your shoulders are, start to curl your neck. Bringing your hands all the way up into your third position. Nice. Let's do it the other way once you've done it that way. So we're going to bring our hands up into our third position, shift our balance point forward. We could also do this with external rotation. We're just doing it internal but if you feel more comfortable with external, we can do. It just changes it a little. So we're going to do 3 breaths, and then your apnea. And as you start your apnea, you're going to start moving your hands and start curling your neck at the same time. So we're going, the ribcage is moving up as the hands move down and the neck curls round. 3 breaths. Good, make sure you're nice and wide through the shoulders still. Make sure our shoulders don't curl in like this when we're using them. So we want to make sure the shoulder blades always stay really nice and wide, that there's no curling in of the shoulders. The internal rotation is just in the socket. Good. Okay, how did that feel? There's a lot going on. And usually you've done a lot of other stuff, because usually this is like 15 hours of work. Nikki, how was that?
Yeah, definitely feel the tight patches, like in part of the back of the rib cage, the pelvis, as Rota taking the head down, the apnea as well. You could really feel the tension there.
There's a lot going on.
Yeah.
And when you think about the multifidus as well, the multifidus going all the way up through to the back of the neck here. You think about the connection to the quadratus lumborum, you know, so the minute we start to engage the neck, we get much more engagement at the opposite end of the body from the heels. Yeah. Good. So let's add a little bit of movement to this. Okay, so we're going to, she says, so we're going to shift our balance point forward. We'll keep it nice and simple to start with. Let's have our internal rotation. As we inhale, we're going to shift back, keeping our hands internally rotated. As we exhale, we're going to bring them up into our third position. And then when we perform our apnea, we're going to start our apnea. We're going to curl our neck as our hands come down and as our apnea grows up. Okay. Yeah, so we're putting a combination together. So ready to inhale and rock back. Keep it internal. Inhaling, rocking back into your heels. As you exhale, rocking forwards, hands are going to move up into the third position. Inhale, rocking back. Excellent. Exhaling, rocking forwards. Inhale, rocking back. Exhaling, rocking forwards. Closing your mouth and nose when you're ready. Starting your apnea. As you start your apnea, start to curl the neck. Start to bring the hands down. Really feeling that engagement, hopefully. Keep the shoulders wide. Good. Make sure it's not a thoracic curl, it's just your cervical spine at this stage. So Britta, when you came into that, there was quite a lot of upper shoulders moving forwards as well. It really is. The shoulders are moving down, and you know, they're like bicycle handles. They're still sticking out towards the side, and the it is really just in that cervical spine that we're looking for the movement. Cool. So just being a little bit aware of what's going on with your shoulders as you come down. Okay, so let's look at extension now, because we were going to put these two together. So there's two ways I teach this. There's the old way and the new way, but they're both, some people like the old way better. So we want to make sure when we come into extension that we don't just throw our heads back and look up, because again, we want that separation of the vertebrae. So I used to tell people that they had a metal spit through their ears, and the spit cannot move anywhere. So they've got this imaginary spit through their ears, and if I'm in a class with them, I actually, if they don't mind, I touch their ears so they can feel what's happening. So then all they do is they rotate their ears around the spit until they're looking up towards the ceiling. So they're still nice and long through the back of the neck, but they're really nice and long through the front of the neck too. You obviously teach extension in Pilates, so you'll have your own ways as well. But just when we're looking for just cervical extension, my new way is a bit nicer. So, other than the spit. So, chin horizontal to the floor to start with. And then we start by tilting our chin up till we can't tilt it anymore without bringing in our nose. So now we're pushing our nose up towards the ceiling until we can't go any further. Now we're going to use our eyes. So we're trying to reach our eyes up towards the ceiling now. And this really helps with that extension at the back of the neck. So it's chin, nose, eyes, shoulders nice and relaxed. So you should feel the muscles, the platysmus, all of this starting to engage. Okay, and make sure that we don't throw our heads too far back. We want to take it to just the point where we can feel length in both sides of our neck, a little bit more underneath the chin. Good. So let's add this into an apnea, shall we? So we're going to do our 3 breaths. Hands can be anywhere, just relax by your side just now, or on your rib cage if you want. So you're going to do your 3 breaths. You're going to close your mouth and nose, pause, start widening your ribs, and as you start to widen your ribs, your chin, your nose, and your eyes are going to look up towards the ceiling. Good. Take your time with it. So think it about as an extension of the apnea. The apnea begins the process and it begins the lifting up of the anterior chain, and this culminates in the extension of the neck. Nice. Good shapes. Make sure we're not pulling our shoulders back. Our shoulders are still nice and relaxed by our sides. Good. Okay. Should we try that with some arms? Oh, yes. So, oh yes. And again, obviously, I'd love you to do lots of practice of this before unleashing your new term knowledge to your masses. So shifting the balance point forward. Let's have external rotation this time, so palms facing out towards the sides. You're going to do your 3 breaths. As you perform your apnea, your hands are going to move up, your ribcage is going to open, your chin is going to go up, your nose and your eyes. So 3 breaths with hands down by your side to start with. Good. Reaching out through your little fingers, shoulders nice and wide, fingers in your peripheral vision, soft toes. Good. And then as you start the apnea, we're going to use the hands to help, because they'll help engage the serratus. And then as they come up, I'd like you to feel them stretching from your heels. As your chin goes up, your nose goes up, your eyes go up. Nice. Okay, how did that feel?
Makes me feel slightly dizzy.
Yeah, to start with, yeah, we're also doing a lot of apneas just now, so yeah, so again, it's a change in the visual. So trying to keep, as you look up, trying to keep your eyes soft as you're looking up can help with that. But it's changing the kind of orientation of where our ears are for proprioception as well. Yeah.
I find when my arms are aloft and I'm going into extension, much harder to maintain the apnea. It just wants to drop.
So you find, so as you're coming up, you find it much harder to perform the apnea. So that's unusual, because usually, with the arms up, because what the arms are doing is that they're actively stretching and reaching the serratus away, which should feel nice for opening the rib cage. Try it following with internal rotation and see if it feels different to you.
Okay.
So we'll have a shot with the internal rotation as well. Any other comments about that one?
Well, the in with your arms up is really hard after the apnea.
So having it up here.
Yeah, and then breathing in after the apnea, I find that really hard.
And the reason is because you're thinking like you need to open your rib cage to inflate your lungs. So when your hands are up here, your rib cage is really quite open already. Because if you think what's happened as we've moved up, the serratus has helped to widen the rib cage. So when you come to inhale, you're just going to fill your lungs. So it's less feeling of having to widen your rib cage to inhale, but more just allowing the lungs to inflate. And that takes a wee while to get your head around, Maxine. But it is one that my clients have quite a lot. They're like, what do I do with my ribs? They're really wide. And I'm like, just have to, so it's about just on, if you find it difficult, so to start with, if you're finding it difficult, you're in the apnea and you need to breathe, just bring your hands down as you do your first inhale. And it'll lower your rib cage, which means there's more chance for expansion. So I would do it.
And it's okay if that increases.
Yeah.
Sorry.
Yeah, to start with, that's okay to bring your arms down. I mean, you can put these arms in any direction you want. You know, that what I'm giving you is a guide. You know, if you think about it, the combination of arm positions you could do is multifaceted. You know, you could do internal rotation like this, you could do it like this, you could take it from here and do one arm and bring it back, and one arm and bring it back. You can experiment with this loads. You could just work one arm when you're rocking to start with, to get people to really mobilize one side of their bodies to start with, and then perform the apnea, and so they can feel the difference in their rib cage. I'm giving you a really standardized thing to work with, but your imagination and your clients in front of you will determine what you do next. There's no wrong way to move the arms when you're breathing. It's about getting as much movement in as you possibly can. Yeah. And remembering the principles. So the principles are internal rotation in the socket or external rotation in the socket, or having a neutral arm if you want to come into neutral. People are struggling with internal and external to start with. But yeah, you could do a really simple one where the hands come all the way up and the hands come all the way down, just to teach people that widening of the rib cage on the inhale and drawing down of the rib cage. So like we're working it like bellows on a fire. So we can use it to really inform the movement of the rib cage as well. I open the floor to you to experiment with your arms, really. I'm just giving you the kind of the standard way of using them. The one my clients like the most, they love this. This is the thing that they're always wanting me to do, is rocking back and forwards, then rocking back and forwards, then rocking back and forwards, and then apnea. And then we bring the hands back down again and we start, and we might this time rock back internal and then come to external. So they like it to be a continuous movement. So rather than just moving one set of arms, you know, and then the next set of arms, we combine the three together. But that's one of their favourites. And I get asked for a lot. So, any other questions about that? Let's add the extension into some rocking then, shall we? Yay! So let's go for it. So, feet hip distance apart, knees nice and soft. We're shifting our balance point forward. Good. Find your pelvis, just make sure it's still nice and floaty, your ribs are nice and floaty, shoulders are nice and floaty. Good. Let's start with internal rotation. Good. So let's do what my clients like the most. So we're going to internally rotate and rock back. No, we're going to internally rotate and rock back. We're going to, this will work out. So we're going to internally rotate, externally rotate as we come back, internally rotate into second, externally rotate, internally rotate into third, externally rotate, apnea, and then do our extension. So starting down in our first position, ready to inhale and rock back. In, 2, 3, 4, 5, 4, 3, 2, 1. Internal rotation second, 2, 3, forward, 5, 4, 3, 2, 1. In, 2, 3, forward, 5, 4, 3, 2, 1. Close your mouth and nose, pause. Start widening your ribs. As your hands come down, your chin turns up, your nose turns up, your eyes turn up, reaching out to your fingertips. Nice. When you need to inhale, inhale here, and exhale, release. Good. How did that feel? We're going to go into a little bit of hair and then we're going to break for lunch, just so you know where we are in the program for today. Okay, so we've been thinking about flexion of the neck, and the principle I've explained to you with hypopressives is that we want to keep as much space in the vertebra as possible. So it's the same when we come into Hera, which is the extension of our talus, which is our hip hinge position. And when we first teach this, we teach it from the hip hinge position. So remember, when we come into the hip hinge, it's all about stretching that posterior chain. And we're going to continue that stretch of the posterior chain with the curling of the back. So we're going to place our hands in a moment. I'll show you first and I'll get you to do it on the tops of our thighs. Then we're going to do 3 breaths, and on each exhale, we're going to curl our spine a little bit more. But I'd like you to imagine, first of all, that flexion where you've got that little ball underneath your chin. So you've got that curl. And then I'd like you to imagine that you've got a beach ball here, that you're going to curl the top of your whole thoracic spine around, still keeping that curl in your chin. Then you're going to inhale for the 3rd time. And as you exhale, you're going to slide your hands down to above the tops of your knees and really curl your lumbar spine. Now, what this looks like in Pilates, which was like a revelation for me when I started learning Pilates, because it made it much easier to teach this, is the spine stretch in sitting. So if you think about what happens in your spine stretch when sitting, you have your hands out here so they're not here. That's one difference with the arms. But you think first of all about curling your neck away from the wall behind you. Then you curl your thoracic spine away from the wall behind you. And then curling your lumbar spine, you're lifting up and over to curl your lumbar spine away. So this is the same shape that we're trying to create in a standing position. So we're going to, this is like starting in our Artemis position. If you think about it, this is almost exactly the same. So if I was to bring this into standing, I would be about here. So we're not going to be quite that folded to start with. So if you imagine you've got that wall behind you, and you're going to curl first of all your neck away from the wall, then your thoracic spine away from your wall, and then slide your hands down to give you a bit more space and curl your lumbar spine away from the wall. And you're going to do it on each exhale. And you can see how you could probably bring the apnea breath into that seated spine stretch as well, because it's the same posture pattern really. So coming into your hip hinge first, feeling that stretch, make sure you're not bending your knees. Remember the bending of the knees takes that stretch out of the posterior chain. Shift your balance point forward. Then you're going to take your inhale, and on the first exhale, curl your neck away from that wall. Then you're going to inhale, and as you exhale, you're going to curl your thoracic spine away from the wall. Then you're going to inhale, and as you exhale, slide your hands down a little and curl your lumbar spine away from that wall. So you've got this beautiful curve, and then perform your apnea. So make sure shoulders stay wide. So it's the same principle. You know, when you're doing it in sitting, you're not wanting the shoulders to pull in the way. You're wanting to keep the shoulders nice and wide. And it's the same here. The shoulders are going to stay wide. It's the spine that's doing the curling. So if you think about the shoulders like bicycle handles on a bicycle, and think about the spine like the wheel going round, the handles don't follow the wheel as we cycle, because that would be a catastrophe. So we want to keep the shoulders nice and wide. So this is one of the cues for clients, is to tap them on the shoulders and make sure that as they're curling, it does happen a little bit. It does curl in a little bit as you curl, it just does. But the predominant thing is to try and keep this nice and wide as everything else curls. So we're not bringing the shoulders in with us as we fold forward. Have another shot of it. 3 breaths, neck, thoracic, lumbar. And when you come to the lumbar, perform your apnea. Nice. And we're wanting the hands internally rotated in towards the tops of the thighs, so we've still got that extension through the wrists if possible. Liz, that looks absolutely perfect, great. These look really nice. So we're looking for that stretch through the whole posterior chain. Looks good. How does that feel in your bodies?
That really helps release your shoulders when you
Yeah.
do the apnea like that. Yeah, it's really
good,
nice
isn't it?
one.
Some people love it, some people hate it. So I'm just saying that now. So if you hated it, that's also okay. So yeah, every pose is different for different people as well. And I used to always say to people that, you know, you get a really lovely feeling of apnea in that position, but not everybody does. Some people get it in positions that I just don't get it in at all. So everybody's slightly different. How did that feel for others? Okay. So we can use this as a transitional pose. And we can actually start from standing instead of starting from here. So we can actually start our apnea breath from our standing position and come into our curl this way. So we do our inhale, exhale, curl our cervical spine. Inhale, exhale, curl our thoracic spine. Inhale, exhale, curl our lumbar spine, and find ourselves back into the same position. So try it from standing. I generally teach it from the hip hinge first, just because it gives people kind of, I don't know, more of an introduction to the curl already. They're already in a kind of that almost, all we have to do is give them a little bit of a twist. So let's start at the top, hands internally rotated. You're going to inhale, and as you exhale, you're going to stretch your head away from your heels, curling your cervical spine. And then you're going to inhale, and as you exhale, you're going to continue that stretch in the body away, the head as far away from your heels as you can. And then you're going to inhale, exhale, curl the lumbar spine, hands above the tops of your knees, contacting them now. So they'll be on the tops of your knees, above the tops of your knees when you come into the lumbar curl. And then apnea. Perfect. Okay, how did that feel compared with starting in the hip hinge position?
Easier.
Easier. So some people will find it easier, definitely. Yeah.
Heard it.
Good. Some people find it harder. It's true. Everybody's different. So we use this pose to transition to the floor. So with a hera pose, we would do whichever one you find the easiest you're going to use for this to start with. So if you find this one, you're going to use your 3 breaths to come to your curl. Then you're going to perform your apnea. And then after your apnea, you're going to inhale, and as you exhale, don't worry, I'll coach you through, I'll just show you so you've got it kind of in your mind's eye what's happening. You're going to inhale, and as you exhale, you're going to press your hand, bend your knees as much as you need to, and press your hands out in front of you. Then you're going to inhale, and as you exhale, you're going to drop your knees as if you're pressing them down towards the floor. Then you're going to inhale here with this lovely curled spine, really breathing into your back, and as you exhale, you're going to pop yourself up into the pose we're going to learn today, which is called aura, and perform our apnea. So this is an upright kneeling pose, which we didn't do in our first section because we had too much to learn. We are doing it here, even though we've got masses to learn here too. So this is aura, which is our next upright position in our sequence. So let's come to standing. We're going to use our 3 breaths into our apnea first, and then we're going to come down. So choose whether you want to start in your hip hinge or whether you want to start up here. And I'm going to do your 3 breaths with you this first time, and I'll let you do it once yourself as well. So ready to inhale. In, 2, 3, curl. 5, 4, 3, 2, 1. In, 2, 3, curl your thoracic. 5, 4, 3, 2, 1. In, 2, 3, curl your lumbar. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Apnea for 4, 3, 2, 1. In, 2, 3, bend your knees and press your hands forward. 5, 4, 3, 2, 1. In, 2, 3, press your knees down. 5, 4, 3, 2, 1. In, 2, 3, up. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Widen your ribs. I got the counting a little bit wrong there, you'll have noticed as you go down. So, there are different combinations of counting, but we will generally, we want to come from our curl position, we want to inhale position first. Exhale, press your hands out in front of you. Inhale, drop your knees down, which is the bit I missed. Exhale, inhale, drop your knees down. Exhale, inhale into your back, exhale, up, apnea. I think that's the right way, yeah. There's lots of different combinations, so just try to give you one, and I've probably given you 3 now. So, try that yourself. By the end of it, by your final exhale, you want to be bringing yourself up from this position to this position. So, starting whichever position you like the best, you're going to come into your apnea first. So, if it's a hip hinge, we'll go from the hip hinge. So, nice deep breath in, you're inhaling, and as you exhale, curling your neck. Then as you inhale, you're going to inhale position, feeling the length. Exhale, curl your thoracic. Then inhale, slide your hands down as you curl your lumbar on your exhale, and then apnea. Then inhale in position, so always inhale in position after an apnea. Exhale, bend your knees, stretch your hands out in front of you. Inhale, press your knees down towards the floor and exhale. Inhale into your back muscles, exhale, pop yourself up when you're ready. Apnea. We're going to talk about this pose after lunch too. Good. So hands should be internally rotated. They can either be down in first position, second position, third position when you pop up, but just somewhere here. How did that transition feel? Now, not everybody's going to like that transition or be able to do it. So for those that can't, there is an alternative. So after their apnea, they inhale. As they exhale, they take one leg behind them. Then they inhale. As they exhale, they take the other leg behind them. And then they inhale, exhale, ready to go for their apnea. So we're not got such a complicated movement pattern to do that some people just can't. Some of my ladies just look at me and laugh. So this is what I do with them when they laugh at me. Just take them down that way. So yeah, it's just a basic step. Inhale, inhale in your position. Exhale, take your foot back. Inhale in your position. Exhale, take your other foot back. Inhale in position. Exhale, ready to go. Apnea. Which is much, much easier. Okay, you guys, how are you all feeling? So, it's going to be lunchtime now. I'd love you to eat right at the start of lunch. I'm hoping that we can come back after 45 minutes instead of an hour, because we've got quite a lot to do this afternoon. If that's okay with everybody. Is everybody okay with that? Okay, cool. I'm asking you to eat at the beginning of lunch, not eat too much, because we're going to do quite a lot of apneas. But if you are feeling that it's too many apneas, you can just take the apneas out for some of the stuff that we do this afternoon, because we are doing quite a lot all in one day. So I'm aware of that. Any questions before we break? No, I'm not sure that's a good thing. I'm hoping that it is. Okay.
So, Abby, I just wanted to ask, you said at the beginning when we started to do all the movement, doing the figures of eights and moving our rib cage and everything, that you needed to do a baseline first. I presume just meaning just standing, thinking about how everything feels, or is it moving to see how things move and then doing those?
Yeah, no, it's just standing. So when you want people to do it, just to check in for their posture, I either get them to do it standing or I get them to start lying down on the floor so they can feel where their pelvis is, where they land. And then we do all this mobilization, the figures of eights, the rib cage and everything. And then I get them to retest. So either lying on the floor so they can see the difference when they come to lying on the floor, or just standing. So it's just sensing how it feels different. And it feels massively different every time we do it. So yeah, it's just a great way to release everything before we begin, because I want to get rid of as many tension patterns as possible before we start trying to lengthen and stretch and do all these other things. So, okay guys, so I'll see you back here at 1:45, and we will get straight back into this. We're going to do this transition again, then we're going to look at Aura, that upright kneeling position, and then we're going to look at all the combinations in quadruped. Yeah. And then we're going to look at some combinations in Hestia. Not as many, because we did most of the arm movement standing. They're the same when we get to Hestia. And then we're going to look at Cellini, our rolling pose. Okay, all good? Yeah, cool. Right, I'll see you after lunch then. Bye, guys. Hello. So, microphones. Sorry, kids and geese and judo competitions and so lovely to see you all again. It's all got to be now, right? I've got a judo competition in 2 weeks. I need a new gi now. I'm like, right. Okay, so head back to the room and nice and breathing. Any comments or any reflections in your time over lunch? Everybody okay? Okay. So let the others join the room a little bit first, and then we'll get started then. So we are going to start this afternoon by looking at the upright pose Aura. So we have a sequence in level 1 that we follow. that goes loaded to unloaded to loaded to unloaded. Remember we talked about this, loaded to unloaded. So there were 2 poses missing from it in the first sequence, first time you learned this. So the sequence goes Athena or Venus, or both, Artemis, so this is the very basic one, and then into Aura. And then from Aura, we go into our quadrupeds, and then Hestia, and then into supine for neutral at the end. So Aura is one of the sequence 1, and it's a loaded pose because we're working against gravity. So we're going to learn it here because it's part of the transition, and so quite necessary. So if you need other things underneath your knees, like I do, because I've been told enough times, I didn't crawl, by the way, I just went straight to walking, and I've got the really pokiest knees you've ever come across, and I blame that completely in that way. They're like really bony little knees, because I didn't get the friction to build more bone, I think. So our Aura pose that we're going to do today is just like the standing, except that we're going to get a little bit more stretch through the front line and the hip flexors. So we're coming to knees hip distance apart. We want to, here at the back, make sure our toes are curled underneath. Now, if people have issues with their toes, they can have a rolled up mat underneath here or a couple of cushions, just so they've got that dorsiflexion in the ankles. If that's not possible, they can come to having the back of their feet on the floor. It'll help them open up through the hip flexors a little bit too, but ideally we want to be stretching that posterior chain with the tucking of the toes underneath. This is one of the most poorly done exercises apart from hip hinge, because when people come to this, they tend to come to it with a slight sit back, like they're in a slight hip hinge, and then they thrust their rib cage forwards. And this is because, I think it's because we do so much sitting, so everybody's kind of stuck in that position and they find it really hard, and everybody's got such a tight psoas that they find it really hard to open up through this area. So just be mindful when you're teaching this to people to make sure that they are, let her in, Christine's not here. Yeah, so just be mindful to make sure that they are actually opening through here at the front and that they don't have the slight sit back position. So we're looking for the pelvis again to be balanced nicely on top of the femurs. We can do a bit of tucking for here, we can do a bit of side to side, we can do a bit of hooking of the hip, we can do a bit of mobilization here too to warm it up if we need to. But just to kind of focus on this area a little bit when you're cueing. You can think about there being a line coming from the knees all the way up through the pelvis to the shoulders if that helps people. Making sure the rib cage is also balanced on top of the pelvis, so we've not got this pressing forward or a curling back of the rib cage here. Okay, if somebody comes to this, so it's very rare that somebody comes to this position and they can totally manage this position really well without feeling that it's too tight at the front. If they are, then the last bit of this pose is to shift the balance point forward a tiny bit, so you get a little bit of active engagement in the posterior chain. So it's like leaning forward in our standing position. But when I teach, I hardly ever teach the lean forward. I'm just putting it here so you know that there's an awareness of it. And also when we rock, we can rock forwards as well in this position if we want to. So in this position here, we can choose our arms. So let's go for some external rotation. So hands out towards the side. And we can start with neutral, drawing them out, and then rotating from the wrist, the elbow, and the shoulder. We want to make sure the fingertips are still in our peripheral vision. Chin is horizontal to the floor. We're not looking down, we're looking straight ahead, and that's really important. Okay. Then I'd like you to sense your heels pressing lightly away, and if you want to take that little tilt forward, you can take that little tilt forward too. And then 3 nice slow breaths and an apnea here. So taking your time here. Nice and open through the chest to make sure we're not sitting back. We're going to do some sitting back in a bit, so we don't need to do it now. So 3 nice slow breaths and an apnea here. And once you've done one in this position with arms, I'd like you to internally rotate it into second because it changes the balance a little bit. So just being aware of that, there has to be slight adjustments through the body when we move here because we're really weighting the front now. Good. So I get women to think about having a torch between their vagina or in their vagina and that shining straight down, and that does help them get out that sitting back slightly position. But these don't look bad. Okay. Then if you're wanting to add the rocking here, which can be quite nice, this kind of, it's like the reverse Nordic curl thing, we can actually come back. So as we inhale, we can stretch back, and as we exhale, we can come back to our starting position. So we don't have to roll forwards. So for me, I know that when I come forwards, it's just a little bit too much for me. So I always start from the upright, but pick where you want to be. And then as you inhale, you can reach backwards. So it's like an ironing board going flat backwards. And then exhale, coming forwards to wherever's comfortable for you in the forwards position. It's quite a good stretch for the backs of the toes here too, which is nice, forwards and backwards. So again, you can do this with moving arms, so hands can be in second position, for example. As we inhale, we can come back into our open arms. As we exhale, we can come forwards. Inhale, we can come back, keeping that nice long line, making sure we're not sitting back at this point. Exhale, coming forwards, and then inhale, coming back, exhale forwards, and then your apnea. And during the apnea, if you want to, you can add a little curl or a little extension or a little arms moving in a different direction. So have a little practice and play around with that one in your own bodies and see how it feels. So feeling that rock back, curling the toes if you can underneath you, sensing the heels pressing away. Good. And this pose is called aura, and it is a loaded pose. So unlike standing, where our glutes are not really firing when we're standing because we're so much bone stacking, your glutes will be engaged in this position. So just because a lot of my ladies are like, oh, my glutes are engaged, I'm like, well, they will be engaged in this position. Because of the position itself, and it's quite nice for building that kind of glute strength and hamstring strength in my early postnatal ladies. They they don't like this pose, but it's good for them. Okay, so how did that feel in your bodies doing it? Good. Okay, so our transition, we're going to use this as a transition pose too. So our transition is going to look like this. We are going to do an inhale and we're going to sit back, keeping our pelvis neutral and keeping our spine neutral. So it's like we've got a little slant, and as we exhale, we're going to come up. Now, the reason this is quite important is that this is a really good movement pattern, is because as we sit back and the femur rolls in, the sit bones widen and we get more of a stretch into our pelvic floor, the same way we do in the hip hinge position and also in a squat. So it's kind of like a nice, safe feeling squat for my clients to start getting them used to that eccentric loading of the pelvic floor that's so necessary for continence. So we're coming back, and as we come back, I quite like as we come back for them, they start with their hands in first, so we get a full movement of the back as well. As they inhale, they sit back and their hands come up into third position. So you feel like they're pushing away with their arms. But you can choose whichever arms you want for this, obviously. And then as you exhale, you come up back into your first position. And it's quite a nice movement pattern to use. You inhale, press back, pressing up with your hands, sit bones pushing away towards your heels, and exhale, coming back up. At the end of the third one, you perform your apnea. During the apnea, so while you open your rib cage, I'd like you to press your sit bones back towards your heels, curl your neck, curl your thoracic, curl your lumbar as your hands come down towards the floor, still hopefully in your apnea, and then you're going to inhale and into this round cat-shaped back and exhale into neutral, ready to go for our quadruped positions. So, let's do it with the apnea, and then I'll teach you it the other way if people are struggling with the apnea, or if you just don't want to teach you with the apnea to start with, or perhaps you've got people who don't do the apnea. So hands internally rotated, and you're going to inhale and sit back. So I'll count, we'll do 3 and 6 again. So ready to inhale and sit back. Wait for Maxine. Cool. So sitting back, in 2, 3, up. 5, 4, 3, 2, 1. In, 2, 3, up. 5, 4, 3, 2, 1. In, 2, 3, up. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Start widening your ribs. As you widen, taking your sit bones back, your hands are coming up into third. Curl your neck, curl your thoracic, curl your lumbar. Hands come down. Inhale into your back, exhale into your neutral spine. Okay, good. So when we come into a neutral spine, remember glutes are extended or open, and our eyes are looking straight down towards our hands. We've got a neutral spine. Okay, how did that feel? Okay, so let's do it without the apnea up there. So we're going to come into our curl on the last exhale. So we're going to inhale, sit back, exhale up twice. Then inhale, sit back, and as we exhale, we're not going to come back up, but we're going to curl our neck, our thoracic, and our lumbar into our exhale, then into neutral and apnea here. Okay, yes, let's go for it and try it. So hands internally rotated. We want to keep it going as a flow for people, you see. So, ready to sit back for our inhale. In, 2, 3, back. 5, 4, 3, 2, 1. In, 2, 3, up. 5, 4, 3, 2, 1. In, 2, 3, curl. 5, 4, 3, 2, neutral. Close your mouth and nose, pause. Widen your ribs for 8, 7, 6, 5, 4, 3, 2, 1. Inhale here. Okay, so to start with, when you first start doing this with people, you want to, I pause, so I give them the opportunity to do an apnea here, and then I'll pause and make sure that their posture is great in this pose. Because quite often when people come down, they curl, they might either be really tight here, so their pelvis is kind of still back, and their back is quite far up, or they might be too far forward like this, and this happens loads, until you kind of find where your landing spot is. So, let's do that one again. Let's do it during the exhale. And when you come down, on your curl, you're curling, you're trying to aim so that when you land, your shoulders can come over your hands, your pelvis can come over your knees, so you've got this nice long neutral spine again. And when we land, we bend our elbows a little, widening our shoulder blades behind us, so that we've got this connection from shoulder to shoulder. So we're coming into our Gaia position. Okay, should we try it? Let's do it. Took me ages to get this one right, by the way. So internally rotating our hands. Perfect, ready to sit back on our inhale. In, 2, 3, up. 5, 4, 3, 2, 1. In, 2, 3, up. 5, 4, 3, 2, 1. In, 2, 3, curl. 5, 4, 3, 2, neutral. Close your mouth and nose, pause. Widen your ribs for 10, 9, 8, 7, 6, and then whenever you need to be, stay exactly where you are. So I'm just going to cue you a little bit. So staying exactly where you are, don't move. So Nikki, I'd like you to bring your pelvis forward a little, make sure your toes are curled underneath behind you, and bring your hands forward a little so you can see what the difference is. Christine, I'd like you to widen through your shoulders so you're not pushing up through your shoulders, so you want to have a neutral spine, much nicer. Jackie, I'd like you to look down towards your hands more so you're not contracting the back of your neck. Jules is good, Maxine's good. Excellent, good. Yeah, much nicer. Can you feel the difference? And Sarah as well, just allow the shoulders to flatten and the back to come to neutral a little bit more. Yes, and then eyes look down towards your hands. So this is where you want to be when you perform your apnea. Okay. So, how did that feel?
It's hard.
Yes. But it's great because we're doing much more movement. So we're getting our body to move in many, many different directions, which is why the flow is so important with the hypopressives. And I move people to these basic patterns quite quickly. This is quite a hard transition though. So this is maybe one I don't give them immediately. Although I do sometimes. So let's come from here. Any other questions about that transition? Should we give it another shot and see how it feels? Yep, let's do it again. And then we're going to go into some quadruped changes. So, toes curled underneath behind us. Internally, we take the hands, ready to sit back. Sit back, 2, 3, up. 5, 4, 3, 2, 1. Sit back, 2, 3, up. 5, 4, 3, 2, 1. Sit back, 2, 3, curl. 5, 4, 3, 2, neutral. Close your mouth and nose, pause. Widen your ribs for as long as you can. Good, these weren't so, no, they're much better. So Jackie, just head again a little bit. Just make sure you're looking straight down towards the hands. Nice, good guys. Good. It's just finding that place, and eventually you find it just becomes automatic. So let's have a look at quadruped, shall we? So next thing we're going to look at is how we're going to build the quadruped into almost a more functional movement pattern. So when we first learned Gaia, and when you first learned it, we learned that we can either have it like this, with hands facing forwards, toes curled underneath behind us, or we can have our hands turned in the way, or we can be up on fists. So we'd find out which one of these works best for our clients, or I'm going to invest in some of those gloves and see how those rock and roll for my clients too. So the first thing kids do when they start to crawl and move their bodies is they push themselves up into this position, or more this position, but we'll come to that in a minute. What they're doing by doing this is they're starting to build up their trapezius and build up the ability to be able to hold their head in line with their shoulders. So this is a great posture pattern for the people to first get people in to start engaging those core muscle groups. It's also about transverse abdominis as well. Now from this position, the next thing that kids do is they start preparing themselves for mobility. So they pull back with their pelvis, increasing their glutes and all sorts of stuff here, so they're going to be better able to stand. So we're going to pull back as well. So they pull back and then they forwards. Pull back, and we're just going to think about what's going on at the posterior chain to start with. Now, what's really important here for our women, and I know a lot of kids probably don't think about it, but for the demographic of pelvic floor dysfunction, we want to really focus on the idea that these sit bones that we've got nice and wide here, these glutes that we've got extended, we want to think about them extending even more as they pull back. So we want to make sure that the sit bones stay almost pointing out behind, and we keep this very neutral spine. What we want to avoid doing, which is what people immediately do to start with, is as you ask them to pull back with their pelvis, they tuck their tailbone under. So they come into this tucked position. And we want to make sure that they don't. So I get them to feel their sit bones first, feel where they are, and then I get them to think about them like they are the lights on a car. And we're not going to have the car lights pointing down towards the floor, we want the car lights pointing out behind us as we pull back. So you're looking to sense when the moment is that you start to tuck. And I get them to really, I watch them the first few times and I stop them when they start to tuck till they can feel what's going on. So we're wanting to keep, as we inhale, we're pushing back, because as we inhale, that's the cue for our bodies, for our pelvic floor to extend or open. So we're inhaling as we come back, our femur's also rolling in and our sit bones are also widening. And as we exhale and come forwards, the sit bones are releasing, the pelvic floor is drawing in, so we're getting this beautiful extra stretch through both the glutes and the pelvic floor. So try it a few times. We're going to do 3 breaths and then into our apnea. So you're going to inhale, pull back, I'm going to have a look at everybody, and exhale, just allow yourself to come forward. We're going to talk about arms in a minute, so just focus on the sit bones and your bum as you come back, and I'll see if I can spot almost everybody. Nice, good, good awareness. Good. Good. So Maxine, watch right at the end. You tuck right at the very end, but it's really right at the end. So just be aware of it, that you're not just yes. Yes, that's better, good. And Pauline, you're tucking a little bit sooner. So keep thinking about the sit bones poking out behind you. So you're tucking there. Stop, 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 stop. Can you feel the tuck? Yeah. So just being super, super hyper aware to start with. And when you start to feel the tuck, you can actually pause and just try and open your bottom a little bit more. Think about your sit bones widening a little bit more. So just pause at that tuck place. Good awareness, Jackie. Nice, Becky, good. Good, Christine, so a wee bit of a tuck there at the end there. Can you feel it? Yeah, so just come forward from where that tuck is. So again, what we're essentially doing here is we're using the breath to extend the pelvic floor, but we're also using the bones to extend the pelvic floor. And most people are trained, they train their pelvic floor in contraction. You know, that's what Kegel is, we're training the contraction. But when you cough, sneeze, do all these things, or run, your body's got to be able to perform under eccentric loading as well. So what we're teaching it here is the capacity to be able to do that, both through breath and through bone movement. So it's really, really essential movement pattern for all of the demographic of women with pelvic floor dysfunction. So next we're going to add the arms, because it's all part of it. So as we pull back with the pelvis, I'd also like you to push lightly back with the arms.
Sorry, Abby, what was the breath there? I got disconnected completely.
Sarah, it's inhale, press back, exhale, forwards. Because we're following the pattern of extension in the pelvic floor.
Okay, I was guessing that, but I just wanted to check before we went further.
Yeah, totally. That's a key point. So when you push back with the arms, if your arms are bent like this, we don't want to be pushing back so that we're like pulling out of our shoulders. I'm just going to mute because it's doing feedback loop. Hold on. And you can unmute if you want to talk, obviously, as we all know now. So as we push back, we're not thinking about pushing back, like really pushing back like this. All I want you to think about is feeling the contact of the floor as you push back, so you can feel the little stretch through the anterior chain and also into your back a little. And then as you exhale, you're going to pull yourself forward. So it's a little bit more effort as we come back on the exhale. Good. So inhale is a gentle push back as we draw and open the sit bones. And exhale, I'd like you to really focus on pulling your body forward, keeping that neutral spine. Good. Can you feel the work that's happening into your obliques from here and into your lats? So inhale, press back. Exhale, pull forwards. Good. So you can do 3 of these and then into your apnea. And so it's inhale back, exhale forwards, being aware of your spine. Good. Much better, Pauline. Starting to tuck there. Feel it? Mm-hmm. And then into your apnea. Okay. How did that feel? Yeah, wrists. We're going to do a bit more with our wrists yet. So what you can do is just stretch them the other way a little bit before we move in a little bit further. And if you've got hypermobile people in your groups, then instead of pushing back and feeling like you're pulling in this direction, you push against here, but you push this way. Actually, it's good for everybody. So you're pushing, so you're holding the hand, but you're trying to push it the opposite way. And this is really good for hypermobile wrists. You always want to push against the stretch with hypermobility and not into the stretch. And that means you're still going to get stretch in your muscles. So that's an important point for working with hypermobile people, is to make sure that all the stretches that we can do, if you're not hypermobile, are possible, but stretching in the opposite direction. So you're pushing into wherever you're stretching rather than against wherever you're stretching. So usually if you were stretching this, you would think about pulling it back the way, but instead of that, you push forwards, but still maintaining the pressure. Okay, sorry, let's do some more of this. Yay, you say. So let's give your wrists a little rest, because it'll be nice. So we're going to come down into Maya, and we're going to do the same pull back, push back position in Maya. So this is in our next one down. So we've got our little square. You're replacing your hands with your elbows, remember? So your elbows should be directly underneath your chest. This should look a bit like a sphinx. But remember, we're not a happy looking about curious sphinx, we're a dead depressed sphinx, so we're looking back through our knees a little, so that we've not got this contraction at the back of the neck. Then from here, you're going to pull back with your pelvis and push back with your forearms, making sure we don't tuck. And then exhale, you're going to pull yourself forwards. So exactly the same movement pattern, but not on your hands and at wrists. Good. Make sure you keep that head in line with the spine, so we're not looking forward as we come back, and we're not looking forward as we come forward. We're going to make sure our head stays nicely lined up. So 3 breaths. I'm just going to put a light on in here. And then your apnea. Curl your toes underneath behind you to keep that feeling of stretching the posterior chain. Good. And Jackie, watch that neck position. So you've got contraction at the back, so look through your arms. So eye line back towards your knees a little bit. Nice. Joy.
Hi. When you're doing that one and also the 4-point kneeling one, can you give into your pelvis once you start the apnea? Can you give into the pelvis tilting at that point when you're doing the apnea?
No, so you still want to keep the pelvis, you still want to keep the neutral pelvis. So when you're in the apnea, you want the neutral pelvis. So
Keep it, that's what I thought. I missed it. My son started talking to me when you were describing that one, and I wasn't sure if you had to hold it because it wants to resist, doesn't it, when you start the apnea?
Yeah. So when you start the apnea, it always wants to tuck under.
It wants to tuck, not resist. Yeah.
So you're not, no tucking.
No, at any point. Okay.
Yeah, good question. So how did that feel compared with being up in your hands? What did you notice about the difference in that one?
A little bit easier.
Yeah, some people think so, yes. Can you feel more of a stretch in your back? Maxine, you're on mute.
Oh, my arms just like that one a lot more.
Yeah. You get a bigger stretch through your shoulders, it feels, in that one as well, which is quite nice. However, it'd be really hard to crawl in that position, so we're not going to be crawling in there. So we're going to come back up. Don't worry, I'm going to swap between the two for your wrists today. So we're going to come back up into Gaia, and we're going to look at the next stage in locomotion for the human race. So we can do this one with the hands pointing straight ahead because it is easier on your wrists to start with, but ultimately we're wanting to bring them in line again and internally rotated. But go with what feels most comfortable for you today. So this time, what we're going to do is we're going to inhale, and as we exhale, we are going to lift our right hand and left knee a tiny bit off the floor, like minuscule, and then we're going to slide it forward a little bit. So what's happening here? You can feel what's happening. Just let's do it one limb at a time. So if you're on your hands, I'd like you to lift just one hand up off the floor, and can you feel that extra engagement you get into your abdominals and into your obliques? Then lift the other hand and feel how it shifts to the other side of the sling. Good, and then lift one of your knees, and then lift the other knee. This is a really basic diastasis exercise actually for helping close diastasis, is just lifting one arm at a time and one leg at a time. So let's put that together just a little. So we're going to inhale. As you exhale, you're going to lift the right hand, left knee a tiny bit off the floor and glide them forward just a little bit. We're wanting to try and maintain a neutral spine. Then you're going to inhale here in this asymmetric position. And as you exhale, you're going to lift your left hand, right knee, and glide them past the other ones just a little bit. Still trying to maintain a neutral spine. Then you're going to inhale, and as you exhale, you're going to lift the right hand, left knee again, and glide it past the other ones, so you've got an asymmetric pose to take the apnea in. And you're going to do the apnea here asymmetrically. Make sure the toes are still curled underneath. Good. And when you need to inhale, stay here, because we're going to crawl backwards. So when you're ready to inhale again from here, you're going to inhale in position, and as you exhale, you're going to reach the right hand, left knee, and slide them back a little past the other ones. Then you're going to inhale, and as you exhale, it'll be the left hand, right knee that you're going to lift a little and slide back. Then we're going to inhale again, exhale, and as you exhale, right hand, left knee slides back, and then our apnea will be on the other side. Good. And then release. How did that feel?
I like this one.
Shot. Sorry.
I like this one. I like this one more than the previous 4.9.
Yeah.
Mm.
So we're getting a lot more engagement through those slings. So if we thought about when we looked at the anatomy trained slings, but also when we think about where the adductors, the obliques, the external obliques feed into the internal obliques, and then in a very cool way as well, our psoas muscle feeds down into our pelvic floor, into the iliacus muscle, but we also have a connection from the pectineus muscle, which is one of our inside leg muscles, or inner thigh muscles, and it feeds into the psoas, so into that iliacus muscle. So we have this great, when we start crawling, we have this great connection between the hips, the legs, and the psoas and the back muscles. So there's quite a lot going on. It's just one of those random anatomy things. Let's try that again, just in your own time. It doesn't matter which arm and leg you start with. The biggest thing here is to make sure we maintain a neutral spine. We don't tuck our tailbone under. And we don't want to take too big a step, because if you take too big a step, you become like a sexy, prowling tiger, and we want to avoid that. I once saw a play where Lady Macbeth crawled across stage like this. It was not great. So if it didn't suit her, it's not going to suit our clients. So we don't want this. We want to be able to maintain that neutrality, which she lost when she did that. So hands directly underneath your shoulders, knees directly underneath your hips, eyes gazing straight down towards your hands. You want to feel that nice length through your neck. Sacrum is drawing away from the crown of your head, heels are pressing away, and then you're ready. So 3 breaths. So Christine, eyes down a bit. Yeah, you did it, good. So you're moving on the exhale, because it's the effort on the exhale. Nicely done. Okay. I love all the quadruped positions because they are such functional movement patterns for us. They help to build shoulders, they help to build neck position, they help to build a correct walking pattern, for gait pattern for the muscles in the hips. We create an extension in the glutes, we create this eccentric loading of the pelvic floor. We're also creating engagement in the obliques, engagement in the transverse. It's really hard to turn your transverse off when you're in that position. And I do use there's an exercise to think about turning it off for a relaxation exercise for the transverse that I do in this position, which we'll do at the end, hopefully. So let's take it down into our Gaia again, and we're not going to crawl our Gaia, but what we're going to do in Gaia is we're going to look at leg extension. And we're just going to switch between the two so your wrists don't get too sore. And then we're going to put things together as a little tiny mini flow as well. So we're going to come back down into Gaia, into Maya, which is our one where we're our Sphinx. Now for this one, what we're going to do is we're going to, once we're in position, we're going to do our 3, let's actually do our, I'll turn this way around. My osteopath told me to turn the other way so I could get the same issue again that I had before with my arm. So from this position, what we're going to do is add in our neck curl. So we're going to have we're just going to hold it as a basic position just now. Nice long spine, looking back towards our knees. We're going to do our 3 nice slow breaths and then our apnea. As we start to perform the apnea, we're going to reach our head away from our sacrum and we're going to slowly curl it round into flexion. And just see how this changes the apnea for you in this position. So this is adding neck flexion to Maya. So make sure your glutes are nice and released. I'd like you to imagine you're on a boiling hot floor that you have to gently touch because this stops you from dumping down too far and you work your shoulders a little bit more. Good. 3 breaths, then your apnea, and then slowly curl your neck into flexion during the apnea. Nice, Becky, good. So once you've tried it with just neck flexion, I'd like you to take it into a little bit of thoracic flexion as well. So what we're going to feel is as we curl into this position, curling the neck, I'd like you then to think about pushing this bit forward too. So you're curling your neck and then you're pressing forwards with your thoracic spine. So your lumbar spine is going to curl a little, but we're not looking to come into a total lumbar spine curl. We're looking to try and keep that as neutral as possible as we push forward. So we're really still thinking about the tailbone pushing out behind us as we curl the head away. I hope you heard that because I was like talking into my t-shirt there. So I find if I put the mic on, it's like I'm shouting at you though. So 3 breaths. Good, Nikki, I'll start with my pelvis back a little bit over my knees, so you're a little bit forward to start with. Yeah, perfect. You'll find it harder to keep position. Cool. So curl, yes, nice Liz, very good. Good, so curl the neck, then press that thoracic forwards as if you really want to curl it. Nice, really good. Good, you'll have another shot of it as well, so it's kind of in your muscle memory a little. If you want to. If you're like, I've had enough of hanging upside down for now, Abby, that's also fine. So you start the curl with the apnea. So if you think the apnea is slowly building and stretching your spine, and then you're going to continue that stretch through the flexion of the neck and the flexion of the thoracic area. Nice, that's really good. Like it. So we're going to stay down here for a moment and we're going to add in a leg extension in this position. So, and we're going to follow the same pattern in Gaia in a minute. So we're just going to kind of learn the pattern down here. And we can add in, once we extend the leg, we can add in this flexion of either just the neck or the thoracic area as well. So we come into our beautiful Sphinx position. We do our 3 breaths, but we're going to time them a little bit. So we're going to do an inhale, and as we exhale, we're going to slide one of our legs out behind us. We're going to make sure that we stay nice and neutral over the top of our knee and not start leaning over to compensate for the leg coming out, which a lot of my clients do to cheat. So our leg is out. Then we're going to inhale and exhale here, just making sure everything is lined up. And we could also take this opportunity to curl our neck if we wanted to, but let's just keep it straight just now. Then we're going to inhale, and on the 3rd exhale, we're going to bring our leg up in line anywhere from the floor all the way up to in line with our spine. But we're not going to come any further than that because otherwise we start to affect the orientation of our domes. So we do inhale, exhale, slide it out. Inhale, exhale, find our alignment. Inhale, exhale, lift the leg, apnea. Now, if somebody doesn't want to lift the leg, they can just keep it on the floor and perform the apnea there. So there are regressions to this pose. So if they wanted to, they could inhale, exhale, and then inhale, exhale, just hold the leg there for their apnea. So there's no reason to lift it off if they don't want to. Nice spine, make sure you're not leaning over too far onto that hip. Good. Now, if we wanted to add more challenge to this, and we'll do it on the other leg, we would inhale, stretch the leg out. Exhale, bring it in. So you could inhale, stretch it all the way up. Exhale, bring it in. Inhale, stretch it out or stretch it up. Exhale, bring it in. And then apnea, and during the apnea, you would slide it up and slide it up to your finished position during the apnea. So this would be like a level 3. So level 2 would be doing all the movement, lifting it up, and then apnea here. Whereas, otherwise, we stretch out on the inhale, which you'll be used to from Pilates. Exhale, drawing it in. Inhale, stretching it out. Exhale, drawing it in. Inhale, stretching it out. Exhale, in, apnea. And then during the apnea, using it the time to extend. So it just gives us somewhere to progress people to if they're finding they want a bit more movement. And you're getting kind of stretch of the glutes, contraction of the glutes, stretch of the glutes, so you're getting much more movement through that whole posterior area. And it's actually quite nice. And it's reminding me that I haven't actually done that with my groups for ages, so I'm going to feed it back in again. There's so much to do with hypopressives, but I mean, with Pilates, you've got the whole leg series that you can add in this breath work with. So you've got all the different leg stuff you can do in quadruped that you can add this into. So you've got all the extension and lifting here in Pilates, and you've also got the lifting to the side. I'm not sure if they do it at Body Control, but I know they definitely do it at BCP. So it's thinking about how you can mix this into your classes, where you could do 3 breaths and an apnea in your class situations as well. I use it for personal training for this one as well, so I get them to inhale, exhale, apnea. Tell how much my clients love me. So, you can build it into what you're already teaching. So this doesn't have to be a completely separate thing. So let's add in the neck flexion here. So we're going to do the same thing, swap legs this time, but we're going to add all the movement, all the things if you want to. So we are going to inhale, stretch it out, exhale, bring it in, inhale, stretch it out, exhale, bring it in, inhale, stretch it out, exhale, bring it in, apnea. As we extend the leg, we're going to curl the neck and curl the thoracic spine. So we've got this really long stretch from the heel all the way up to the crown of the head. Okay, there's only a few more here, I promise. Now we're moving on to something that is less upside downy. Good, Maxine, don't come that far because you're starting to arch your back. So come down with the leg a little bit. Yeah,
Okay.
there. Yeah, there. Inhale out, exhale in, inhale out, exhale in, inhale out, exhale, apnea, stretch the leg out, curl the cervical and the thoracic spine. Yeah. So it can become really dynamic. So if you think what's happening here, we're stretching the body this way, in and out like a concertina like this. At the same time, we're doing the breath the other way. So we're going sideways, in and out with the breath. At the same time as doing sideways with the breath, we're also doing lengthways with the breath between the pelvic floor and the diaphragm. So we've got all these different movements going on that have been curated so that we can activate as much movement in the fascia as we possibly can. And it's really important that this pelvis becomes the most mobile thing that we've ever created as well. So we don't want to be holding anything too static. We want to just be really aware that the pelvis moves while we breathe. So on that note, let's come up and try that movement pattern we just did. So you use the same pattern, but we're going to go to the extreme. So you could, in Gaia, do what we did to start with. Inhale, exhale, inhale, exhale, inhale, exhale, apnea. You could hold it here. Or you could go to the full extreme. So you can decide which one. You're going to do one on each leg here. You could do inhale, exhale, inhale, exhale, inhale, exhale, apnea, stretching the leg out in the apnea as you curl the neck. So just curling the neck in this position rather than the thoracic spine as well. So just coming into a neck curl. We're really stretching from one end to the other. Have a shot, see what you think. Hands can be out of the way, curled in the way, or on fists if your wrists are getting a little bit sore. So coming all the way up into our top pose. So again, we're coming into Gaia rather than Maya, so arms are extended rather than into our Sphinx. Hands are directly underneath your shoulders. Good. And just feel how this feels here. Nice. Make sure the other toe is curled underneath behind you. So you've got that still that stretch through that shortened part of the posterior chain. Then you're lengthening one side. Good. Nice, guys. Nice and dynamic. Good. Okay, how are you all feeling? We've got 2 more poses to learn in these quadrupeds and then we're done with quadruped into sitting. Well, kind of, we've got one more, yeah. So, the next one is lovely and I really, really love this one a lot. So we're going to come back to Maya to give your wrists a rest. And from here, we're going to do our 3 breaths and our apnea. During our apnea, we are going to press up with our legs, loading the front of our body. So it's not like a downward dog, this way because my hair's getting in the way from talking to you. So it's not like a downward dog position where we would pull back into our pelvis. What we are doing is loading the shoulder girdle. So we do our 3 breaths, our apnea, load the front, press up with the legs. Nice neutral spine, apnea. And it's such a nice position. Now, if you struggle in the apnea for this position, you can just come up during the last exhale. If I had people who couldn't do the apnea, I would be more likely to get them to do an inhale and then an exhale down, an inhale and then an exhale down, an inhale and then an exhale down into their apnea. No, not into their apnea, just into the next set poses. So let's do it right back to basics. There are so many combination, guys. I get really excited about how many. Let's come back into Maya, which is our Sphinx. And let's do 3 nice slow breaths and then your apnea. So whenever you're ready, you're going to do your breaths. And then during your apnea, you're just going to load your forearms and press your legs up. And that's the only thing that's happening here. Good. Nice, Becky, good. These nice shapes. So load the forearms. Good. Now try coming up on the exhale and performing the apnea when you're up there. So do your 3 breaths. Come up into the top pose when you're on your last exhale and take your apnea from that point. You don't have to do 3 breaths, you can just do 1 to test it out. So do an inhale, exhale, come up, apnea. Good. Maxine, what's your head position? Because you've got that contraction at the back of the neck. So look through to your feet a bit more. Perfect. Good. Questions? Everybody okay? Okay, so we can do this obviously in the other pose, Gaia, as well as Maya.
Sorry.
Yes, Sarah.
So when we're doing all these last ones we've been doing since lunch, we're not counting the 3 and or 4 and 8 or 6 and 3
Yes,
or
you
anything.
would be. Yeah, you would be.
Oh yeah, okay.
Yeah, if you're doing counting with your client, you would be. Otherwise, you're looking for them to exhale for twice the amount of time they inhale for. That's just a standard. So if I was doing a class with people, then they would be here. They'd be inhaling it 1, 2, 3, back 5, 4, 3, 2, 1. 1, 2, 3, back 5, 4, 3, 2, 1, etc. Then they're apnea. And if they're crawling forwards, it'd be 1, 2, 3, lift and crawl, 5, 4, 3, 2, 1. Yeah. So there would still be the counting there for my group classes, definitely. Yeah.
Okay.
That's okay. So Gaia is our upright one. So we've got one more of these, then we're into Isis, and then into our transition to sitting. So we've got our Gaia position here. So we're going to do our 3 breaths or apnea. As you perform your apnea, you're going to load your shoulders by having your shoulders directly over your hands. And then you're going to press your legs up into your extension position. So again, we are not going into a downward dog. We are loading through the shoulders. And if you can get your heels towards the floor, great. But that's not where the weight is based. Weight is based over the shoulders. So 3 breaths and your apnea. And then pushing yourself up. It's like almost like you're about to go into handstand almost. Nice. So don't load back, Britta, load the shoulders. Yeah. Nice, Jackie, good. Does it nice? This is obviously harder for most people than the pose we did before when we're on our forearms, because we're pushing up through our hands in the upright position. And at level 3, we start crawling this and doing all sorts of things up here. But for now, that's enough. Here. So if, for example, you wanted to put this into a lovely little routine for someone, just as a quick overview, you might go, because you've done a lot, so I'll just show you. You might go inhale, exhale, inhale, exhale, inhale, exhale, apnea, curl, 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 inhale, exhale. Then you might go inhale, exhale, apnea. Then you might go inhale, exhale, crawl, inhale, exhale, hands and feet together so they're side by side. Then your apnea, you might push up, you might come back down. Then you might go inhale, exhale, apnea, curl your neck around, and then repeat on the other side. So you can see how it can all go together like a nice little flow. When you're not so tired, it'll be really exciting, I promise. So, any questions about all of those? I will send you, what I'm going to send you alongside all my extra help for you guys is I'll send you a little video of a class where we do all this crawling, so you can have an idea, give you a bit more of an idea about.
What's the maximum number of people you will teach this to? Do you keep your classes really small?
When I first start out with people, I start one-to-one. So they start with me one-to-one. And then they join in with a group class. Initially, when I first started teaching, I kept my classes to just 6. So it was 6 and then 10 and then 12. And now online with people, I generally do not just one-to-one session with them. I'll do 3 sessions or 6 sessions one-to-one, and then I feed them into my group classes, and the group classes are much bigger online. They're about between 18 and 20 people online. But I keep my eagle eye on them all, and generally what I do is do kind of collective group coaching notes, but quite often I'll get in touch with people afterwards. If I've seen lots of like bum tucking and things, and I'll get in touch with them and say, listen, I'd quite like a 15-minute chat. And we'll go on Zoom for 15 minutes and just sort it out together. I have been told that I give away far too much. You know, I want people to do it really well. I want people to get continent, and I want them to have great pelvic floors, and that's what my driver is. So, yeah. Yeah, cool.
With what you're saying there about, you know, the keeping the pelvic floor functional as possible for as long as possible. So if you've got someone who hasn't actually got any real issues per se, but just feels they don't want to end up being told to go down the ten a lady pants direction, would that be, that's fine for them to come to our sessions, isn't it?
Yeah, totally. The majority of women walking about, especially if they've had babies, even if they haven't had babies, after a certain age, if they've had trauma, coughs, whooping cough, all this sort of thing, will have some sort of prolapse. They just won't know about it. And when you go to have your cervical smear, the nurses can tell whether you've got prolapse or not, but they're not allowed to tell you because that's not in their pay grade. So it'd be really nice if they could tell people that they've got you can walk about with a stage 2 bladder or uterine rectocele and not really know about it. You know, it can be pretty unsymptomatic. And the issue then comes is if you are doing quite a lot of high impact stuff, say, or suddenly you get a lot of grief or a lot of you know, you send yourself into fight or flight, this can really affect the collagen, or also as we age. So a lot of women think they've spontaneously had a prolapse, but all that's actually happened is the collagen has got less grip to it, so to speak, and they suddenly start to become symptomatic. But they've probably had the same prolapse for ages. It's just the collagen's managed to stop it from having symptoms.
So are you saying that like people with incontinence, like I have quite a few clients say, don't enjoy dancing anymore, but still want to dance because of that little dribbles every now and again and stuff like that. Yeah. That's actually prolapse.
It's either prolapse or it's a timing issue, or it could just be that they've got too much stress in their life, or something's happened traumatic that's made their nervous system go into disarray. And if we can get them to do nice attention to breath breathing and focus work where we're working the pelvic floor, then we can get incontinent again. A lot of women I see don't have prolapse but have incontinence issues. And those incontinence issues are not necessarily something that's a mechanical issue. It can be a timing issue, and it can be a stress issue, massively a stress issue. And that's not stress incontinence, you know, it's actually just stress. And then it can create stress incontinence for people and urge incontinence. Urge incontinence can come from anxiety. Urge incontinence, you know, where they go in the door, or they get out of the car, or, you know, there's a moment where they think I really need to go. You can actually untrain that with working with people's brains. So if it's when they go to put the key in the door, I get them to go and get the key out of their pocket, and then they put the key back in their pocket and they walk away from the door. They go and do something else entirely, then come back to the door. And they do this a couple of times till they disassociate the key in the lock of the door and needing to go for a pee immediately. Because it's their brains more often than not playing tricks with their nervous system. So it's not always about a mechanical issue, but we can't really know that until we have a conversation with them. And my conversations and my screening for people are about when they have the urge incontinence, how many times they get up to pee at night, you know, what's happened in their lives. Was there an event in childhood? You know, was there an event in childhood where they had an accident and they hurt their coccyx? Did they have a skiing accident? You know, it's getting the whole picture instead of just looking at the dysfunction for me with my clients. And the more I learn about it, the more the questions build up on the sheet. It's going to be like a whole essay. But yeah, I had one client and she's had so many issues and nobody's really asked her about anything, and she got crushed by a pony and broke her pelvis when she was 10. You know, and I had another client who had anal prolapse when she was 2 or 3 years old, and they manually shoved it back up, and she has had issues ever since. And she only found out about this when her mum died, and her mum told her just before she died about it. Oh, I think this might be where all your problems have come from. So it was a trauma with her. You know, it was a trauma of not understanding why she had this pain suddenly, and you know? So, and that's preempted the prolapse later in life. So when we got rid of the trauma, and so I'd identified and working through that, her prolapse issues started to get better. And, you know, so you just don't know where it's come from. So it's about, the great thing about hypopressives is we tackle a lot of this just with the attention to breath, the posture, the engagement of the muscles at the same time as we're using the breath, and that the really focused mindfulness on the exercise and on the breathing makes a huge difference to the nervous system. So we're tackling the nervous system, the posture, the timing issues, all of it at once. Okay, so now we've hung upside down and done all these cool things, hanging upside down. We are going to come into the last upside down position, I promise. And this is the third position in the sequence. So if our sequence goes like this, load it, unload it, load it, unload it. This unloaded position needs 3 arm positions, just like we've got 3 arm positions here. So first arm position is Gaia. Second arm position is Maya. Third arm position, we bring the fingertips together, slide the elbows out, rest the hairline gently on the floor, and this is Isis. This is our third arm position. So we're going to have a shot of this one and then use it as a transition. So we come from our box. Then we replace our elbows with our hands with our elbows. And then we bring our fingertips together and then slide our elbows out along the floor until we can bring our hairline so it's lightly resting on the floor. We're not pressing into the floor with the head because we're all in the business of lengthening the spine, not contracting it. These look great. Good, tuck the toes underneath. 3 nice slow breaths and then your apnea. So real attention to breath. So elbows down. So we're coming all the way down. So elbows down to Maya. Fingertips together. Press the elbows out along the floor and draw your hairline towards the floor. Brilliant. How did that feel? So it's my question. How does it feel? Some people think that's the best one and some people don't.
That was by far the longest one I've managed. It felt easiest.
Good. So the rib cage is already pretty far up and open when we're in that position. We press the elbows out towards the side. The serratus anterior will have pulled the rib cage apart. It's got the antagonistic movement between the diaphragm and the rib cage. So it's pulled it apart, or team player rather than enemy. And then, so for some people they find it harder to get the apnea up here, and some people find it easier. If you're looking for this in your sheets, it's on the transition one. So there's a transition pose, and actually it's got Vadim in it, and he's doing a transition to sitting, and he's actually already got his legs crossed, but the actual full position is with the legs uncrossed. I wasn't going to add it in, and then I realised I had to for the transition for you guys, because some people find this one really difficult. So, and I had to.
So just going to ask, with the apnea that we're doing with all of them, you're trying to increase the length of time of the apnea. Or count through it.
Yeah, so some people will start at 6 seconds, some people 8, but you're trying to get people to an average of 10 to 12 with a maximum of 15. If somebody was unable to hold to 10 to 12, I would definitely not take a breath away if I was training them for sports events. They'd have to be able to hold the apnea for that length of time and be that confident with their carbon dioxide tolerance before I took a breath away. So we're aiming, most of my classes are they hold about 10. 10 is comfortable for most people. We also don't want people to go into a nervous system response, you know, so I want it to feel nice and comfortable. Oh, at the end of 10, I'm definitely going to be able to breathe. I don't want people to be holding to the point where they're like, you know, like massively over holding.
Did people say to you they have an urge to swallow?
Yeah, so at the end you can get an urge to swallow, because what's happening is as your diaphragm, as you're widening your ribcage, your diaphragm is drawing down, your pelvic floor is drawing up, but your epiglottis is drawing down. So what happens is that it can get quite tight, so people get a feeling that they need to swallow before they breathe, or they need to take a really big in-breath. So that's what Maxine was talking about as well, is that they need to do that kind of breath, and it's to try and release the epiglottis. So what you can do is either gulp before you take the apnea, or move your neck from side to side to release any tension there.
So that's what I was actually doing before. When I finished my last exhale, I was taking a bit of a gulp then before I went into the apnea.
So
Is that what you mean? Is that okay? No,
So,
before I start the apnea, I was taking a little bit of a swallow.
so that sounds more like you're taking in air before you do the apnea. So it's like a preservation thing.
Yeah.
It's like your body's going, oh, I need to make sure there's enough air for me to do this. So I try and avoid doing a gulp before you go for an apnea, but use the gulp if you need to at the end of the apnea.
And use that one, right? Okay.
Yeah. Try doing that.
I felt almost like the gulp was closing the area that was wanting to take the air.
Before the apnea?
Yeah, I felt almost by, it's not so much a gulp, just a small swallow. I felt that was closing this area that was building up.
So what we want to be aware of, so a thing to think about here, Joy, is that we're wanting these diaphragms to all work simultaneously together. So a lot of times when I see this being taught on the internet, people say to do a glottal stop, to almost hold the tension, hold the air out from here, and then open their rib cage. But that becomes like a Valsalva maneuver, so it creates more pressure down the way. So we want to, at the beginning, before you do the apnea, to have your epiglottis and things as relaxed as possible before we go into the apnea. So try not to create any tension or close off before the apnea. So if the gulp is there to try and close off the epiglottis before the apnea, we need to take the gulp out.
Take it out, okay. And definitely
just think about being super relaxed here before you go into the apnea breath.
Yeah.
And it's really about closing just at the nose and the mouth, because we want to have this connection between the diaphragms when we do the apnea.
I was finding with that a little bit, maybe not quite the same as Joy, but I noticed when we've added more movement into it, I was actually at the end of it, instead of wanting air, I actually was still blowing out air. So I was holding air, which I didn't think I was doing, but it was like.
So what happens when we start to add the movement as well, people start to sneak air in when they do the apnea. So as you're moving, it's like an unconscious thing. It's like, oh yeah, I can hold for ages, sneak a little bit of air in. As you become more proficient at this, you'll do that less and less. If you're exhaling air, it means that during the apnea you snuck air in somehow. Okay, and remember with this, the thing is, no tension here, close at the mouth and nose, and we want to, what was the other thing? Not over exhale. So when you're exhaling, it's just a nice natural exhale. So make sure you're not over exhaling before you come into the apnea. If you over exhale, you're going to create too much contraction in the abdominals, and you're going to find it really hard to open your rib cage. And also you can't exhale all your air anyway, so it's a total misnomer, and I hate it when people say it. I used to say it in my practice, and I was like, oh my God, why am I saying this? We're always going to have residual oxygen in our body, so we want to just exhale naturally. Okay, should we look at the transition into sitting? And then we're just going to briefly look at sitting, because you have it's just the same arm movements as standing. That's all that's changing. And then we're going to look at rolling, and that's us done. Ta-da! We're good. Yeah? So let's look at this transition, because it's a lovely one, but also one that a lot of my ladies some of them don't do, they just laugh at me. So I'll talk about the alternative as well. So we come from our lowest ISIS position, and then what we're going to do in a moment is we're going to inhale, and as we exhale, we're going to cross the legs over at the ankles. Then we're going to inhale. As we exhale, we're going to press back towards our sit bones. Then we're going to put our hands next to our knees for our next inhale, and we're going to exhale, pressing ourselves over into our HESTIA and apnea. And yes, Polly's laughing at me. The same way my ladies laugh at me. They're like, ha ha ha, that's not happening, Abby. So you've got a couple of options here. You can either do that one, or when you come back, instead of crossing your legs under, you slide your legs out towards the side. Then you inhale, sit back, put your hands here, slide your legs round, and choose whichever leg position you would like, and it's a bit easier. Or for everybody else, they've got 3 breaths to get from there to here in whatever way they want. So they don't have to do any transition if they don't want to. So let's do the full transition. Let's have a look at the alternate, and then you can see which one you prefer or like. So we're coming from ISIS. Good. We've done our apnea. So we're going to take an inhale to prepare. Exhale, cross your legs. Inhale, press back. Pelvis to heels. Exhale here. Inhale, put your hands next to your knees. Exhale, pop up and over. Apnea. Yeah. So, ideally this is what we'd like to be able to do, but it's not, you know, there's lots of reasons why people comment, from tight hip flexors to wrong arm length. So some people got shorter arms, it's really difficult to push yourself over. There's so many different reasons why. You know, there's a yoga pose where you swing your legs through, and my arms aren't long enough for it. So there's lots of reasons. So, the other one is, from ISIS, we inhale. We exhale, slide our legs out to the side. Inhale, sit back. Exhale, put your hands next to your legs. Inhale, exhale, bring your legs around. Much, much easier. Or 3 breaths to get into position. So we're just going to do a quick reminder of FASCIA and the 3 leg positions. There are lots of other combinations we can do, but I've fed you so much information today. So we're going to, you know, come to some of my classes and learn the other ones. It's just 5 minutes on them. So you can either sit with your legs crossed. Remember, you want to feel sit bones underneath you. Dorsiflex at the feet. You can have your legs out in front of you with a little bend in them. Hip distance apart, squishing your marshmallows, drawing your heels back towards you. Or you can have your knees bent a little bit more, feet and heels together. Push your legs out towards the side, still dorsiflexing, and still feeling like you want to pull your heels in towards you. So these are our 3 positions. Let's pick one arm, one head thing to do, just as a wee reminder of what we could do here. So pick whichever sitting position you prefer. I prefer cross-legged, but I'm going to sit like this because it's where I am. We're going to take our hands externally rotated. You're going to do your 3 nice slow breaths, your apnea. As you perform your apnea, you're going to tilt your chin, your nose, your eyes up, and we're going to bring our hands up to a T. So we're not going to bring them all the way up, just to a T. So 3 breaths here. Let's have a little bit of movement, shall we? So we're going to inhale, bring our arms up. Exhale, bring your arms down. Inhale, bring your arms up. Exhale, bring your arms down. Inhale, bring your arms up. Exhale, bring your arms down. Close your mouth and nose. Pause. Widen your ribs. As you widen your ribs, you're going to start tilting your head. Bring your hands up to your T. Nose, eyes. Holding here. When you need to inhale, inhale here. And exhale, release. So all those combinations we did earlier, you can do in sitting. You can do it sitting on the floor, you can do it sitting on a football, you can do it sitting on a chair. So there's always options for people to use who may not want to stand or want to sit on the floor. So we can always use those other ways of working with people. Let's go into our rolling now, before you die on me. So, this pose, Savini, is one of the first poses I teach people, because it's, especially with movement, so introducing movement, and it's one of the last ones I'm going to teach you today. The reason why is because you can really feel the progression of the apnea breath in this pose. So we're going to start just with a static pose, and then we're going to roll it. So we're going to come down onto our backs. We're going to slide our left, the leg that's closest to the screen actually is probably the best way to do this, so you know. So leg that's close to the screen, a bit underneath us. So it's not going to be directly underneath our hips, but a little bit underneath our vulva area. And we're going to cross the other leg on top. So the leg furthest away from the screen is crossing on top. Both our feet are dorsiflexing. Then we're going to bring our hands into internal rotation, second position to start with. And we're going to take our hand that's furthest away from the screen and we're going to tuck it underneath the other hand. So the palm is touching the back of it. Then we're going to bring our hands down towards our pelvis into our starting position. I'd love you now to do 3 nice slow breaths, and then during the apnea you're going to slowly move your hands up above your head. So you're going to do the movement of the arms during the apnea. So 3 breaths first. Take your time, focusing on that widening of the ribcage like an umbrella widening, and exhaling. And then at the end of the third one, you're going to close your mouth and nose, pause, and slowly widen your ribs. As you do it, moving your hands nice and slowly up above your head. So the movement is with thinking about pushing through marshmallows or honey. Good. And then swap your legs over and do it on the other side. So same thing. This time the leg that's closest to the screen is crossing over. Hand that's closest to the screen is underneath. Hands down towards your pelvis. 3 lovely slow breaths, and then your apnea. So hands start at the pelvis, so we've got somewhere to go during the apnea. And then as your apnea builds, you're going to slowly press your hands up from your pelvis all the way up into your third position. Just being mindful again that your ribcage stays on the floor. So we're not wanting to arch our back, we're wanting to keep the ribcage balanced on top of the pelvis. Well done, everybody. Make sure those feet are dorsiflexed. Good. Okay, then from here, once you've performed that, we're going to add a roll. So we're going to do it over 2 apneas. So I'm going to start with the leg closest to the screen underneath, because I'm going to roll that direction. I'll just show you. So we're going to do our 3 breaths, then our apnea. During your apnea, you're going to move your hands up quite quickly above your head, and you're going to twist from your obliques and your pelvis onto your side, like you want to wring out a dishcloth. Then you're going to rest your ear on your arm. You're going to make sure that you're not slumping your ribcage down to your abdominals down towards the floor. You're going to lift them up a little bit. We're going to do 3 nice slow breaths here. And then for your second apnea, you're going to start a spiral towards the floor. So you're going to start with your eyes, your head, your shoulders, your ribcage, your pelvis, your legs. Nice and smoothly and controlled back to the floor. Let's try it, and I'm going to give you some ways for people to get over onto their side if they're struggling. So let's just try it first time. So whichever leg's closest to the screen is underneath. Whichever hand is closest to the screen is on top. Bring them down towards your pelvis. And you're going to start with your 3 breaths. So 3 nice, make sure the arms start at the pelvis, good. 3 nice slow breaths here. And then when you're ready, when your apnea starts, you're going to move your hands reasonably quickly up above your head and twist onto your side. Using those obliques and that pelvis to twist you. Then you're going to do your 3 breaths there on your side. And during your second apnea, you're going to start twisting from the eyes, the head, the neck, the shoulders, the ribs, all the way back down to the floor. Still maintaining your apnea on the way down, which is hoped. Good, and then try it the other way around as well, because you'll have one side that's much easier than the other. It's just the way it goes. Good, make sure the feet are still dorsiflexed. Make sure the waist stays slightly lifted when you're on your side. Make sure your pelvis is stacked. Good. It's nice. So to start with, you might find that you come down all in one rather than as a twist and a spiral, and that's okay because it's something to work on. I'll wait till everybody's back down for that second one. I'm going to go through a couple of things you can do to help people to start with, because I know what the first time I did this and twisted, I had to use my leg. And my friend who's a physiotherapist was like, perhaps, Abby, that you're not ready for this yet. I have some cheats, because rotation is really important to get the obliques to kick in properly. So, you know, we can teach the rotation on the way down and eventually get here. So for those who are struggling, as the hand moves up, they can slide the leg that's on top up the inside, at the outside of the other leg, and then use that knee to help bring them over onto their sides. Then when they're there, they can slide the leg back down and perform their 3 breaths and their apnea, which is much easier. The other cheat you can do is to use your ankles, which isn't actually using your torso as well as I'd like to, but it's like creating a spiral from the bottom up. So you can actually flick with your ankles to bring you over onto your side. What we're ideally looking for is for it to come from the obliques and the pelvis, but initially, to give people the confidence, the heels can be quite useful. Rotating down, with my clients, if I'm in a room with them, I can be behind them and help guide them down slowly. So if they don't mind me touching them, I can actually hold their head, give them a little bit of support so that the next thing is their shoulders, their back and their legs. So this is Cellini in rotation. How did it feel?
You've got yourself rolling completely over onto your front.
So you have it, yeah. So just being available with arms and things to stop people. But to start with, quite a few of my clients have rolled forwards. And yeah, it breaks the ice in a class. You know.
Keep rolling curly.
Yeah. But yeah, so it's just about doing it a bit slower rather than doing it quite so fast, slowing down the spiral. Okay, how are you all feeling? It's quite a lot of information. I will send out the electronic copy of the sheets to everybody, and I'm also going to include a class, so there's a lot of movement in it, so you can see how things feed together as a flow. And I'll also send you access to the part of my website where the stuff for body control, so you can have a look at all the stuff on there. And I'll keep adding to it, so that, you know, look back and check it out. Just to give you help, I've got guides all over the place, but I'm starting to do just a step-by-step guide for each pose, which I will stick up there as well, just so you can refer back to it easier than looking at a whole video if there's just one pose you're wondering about. Yeah, any questions? Have a stunned you all.
Abby, I've
Yeah.
got a question, please. You mentioned when you've got your clients, you send them out a questionnaire. Could you share that questionnaire with us? Because obviously with our clients, we only have the body control questionnaire, but obviously if we're looking for prolapses, you mentioned certain questions we should perhaps answer. And if you've already got a questionnaire, that
I don't mind sharing it, no.
Yeah, do you know what I mean? Because there are probably things on your questionnaire that clients might be a bit shy about telling us, but if it's there as a question.
Yes, so I've amalgamated, there's actually a standard prolapse questionnaire for physiotherapists and a standard urinary incontinence questionnaire and a standard rectal incontinence questionnaire. So I've kind of amalgamated the best questions and put them into mine, along with a standard, you know, are you dizzy when you stand up, etc. questionnaire. So it's all kind of included. So I'll send that to you. Yeah.
Lovely, thank you very much.
Yeah, any other questions that you guys have? Have you enjoyed it?
Definitely, yeah, very
good. That's the most important thing. Is, you know, it's quite an enjoyable practice for people to do with the, you know, end point of, oh yes, so Pilates stuff you can do with this. I already showed you a few, but you've got things like when you're you've got rotation here. You can rotate and then use the apnea. I use this one all the time, where we call it something different in BASI. So over this way, so they just, instead of going over one side then over the other, they just go one side. So they go an inhale, exhale, and then their apnea here. And sometimes I'm really horrible to them. We take them into a wee narrow bridge as well. You can do all sorts. You can do rotation here. So you can do your inhale, exhale, and then into your apnea. There's so many combinations that you can use. Pilates lends itself so ideally to this, that once you've taught them the breath work and the apnea, you can just shoehorn it into the classes you already teach. So you can do an amalgamation. Some of my clients do an amalgamation, some of my trainers do an amalgamation. Some do one where they do like 10 minutes of hypopressives at the beginning and then go into their Pilates class, use it as a warm-up. Some people use it at the end as well, so kind of as a cool down at the end, and they might only use maybe the supine pose, maybe the sitting pose. So it's entirely up to you. It's all for us at the IHC is all about spreading the news that you can engage your pelvic floor in a really active, functional way without gripping. Yeah, and it's the biggest thing is the gripping we have to get rid of from society. Gripping teeth, gripping pelvic floors, gripping ribs, gripping bums, just gripping. It's just too much. And that's kind of where I come from. Don't let it flow a bit more. Yeah. Anyway, any other questions?
If we want to join one of your classes, we go onto the site you gave us last time and then just sign up for it?
You can, but if you want to come and just try one out to start with, then just email me, tell me you want to come, and I'll book you